Good afternoon, everyone. Namaskar. Ram Ram. So we are discussing identification. Very important topic, identification. How to identify person. Now the next important word for identification is we will discuss how to identify race. चलो हमने कल क्या पढ़ा था? The last topic क्या था? Which is the most common variety of fingerprint? Which is the most common variety of fingerprint? Anyone? Yes. What is the answer? Loop variety. Loop is the most common variety of fingerprint. Very good. Most common variety is loop. Minimum points to be same. How many points should be minimum to be same? 10 to 12 points. 10 to 12 points. First fingerprint bureau, Kolkata. Kolkata. Oscilloscopy discovered by Suzuki. Which part of the palate is used for identification? Hard palate or soft palate? Hard palate. Skull X-ray are used in which technique? Skull X-ray. Superimposition technique. Physical measurement, descriptive data and body marks are used in anthropometry. What is another name of anthropometry? Anthropometry is also known as Bertillon system and portrait parley. Bertillon system and portrait parley. Okay. So now we can proceed for the next. How to identify race. For race identification, we use syphilic index. Race identification, we use syphilic index. How to remember? RACE, race. C is syphilic index. Syphilic index is an index of skull bone. Syphilic index is an index of skull bone. What is syphilic index? Breadth of skull bone breadth of skull bone divided by length of skull bone into 100. Breadth of skull bone divided by length of skull bone into 100. This is known as syphilic index. Breadth of skull bone, this one, divided by length of skull bone. Now, how to remember syphilic index? A very simple trick. Dumb. D-U-M-B. Dumb. This is a trick. What is a trick? D for dolichocephalic. D for dolichocephalic. M for mesaticephalic. D for brachycephalic. So if you see the value, it is 70 to 75. It is 75 to 80. And it is 80 to 85. This is the trick we can remember. Dolichocephalic is present in Negro. Dolichocephalic is present in Negro and pure Aryans. Negro and pure Aryans. Indians are not pure Aryans. Indian is a mixture. So Indian syphilic index are mesetisyphilic. Very important MCQ comes. Indian syphilic index are mesetisyphilic. Chinese syphilic index are also Chinese syphilic index are also mesetisyphilic. Okay. Mongol, the syphilic index of Mongol is brachycephalic. Syphilic index of Mongol is brachycephalic. So you can get this question, very important. Indians are meseticephalic. Chinese are also mesetic cephalic. Pure Aryans are dolichocephalic. Dolichocephalic. We are discussing how to decide race. We are discussing how to decide race. For race, we use a skull bone index, that is syphilic index. That is syphilic index. So you can see this is the first one, dolichocephalic, meseticephalic, and brachycephalic. What is a trick to remember? Dump. What is a trick to remember? It is D-U-M-B, dump. Dolicho. So Indians are meseticephalic. Indians are meseticephalic. Now, sir, in Mongol, everything is goal. Face is goal. That is Mongol. Orbits are goal. Face is goal. Orbits are goal. That is Mongol. And palate is parabolic. This is Mongol. Palate is parabolic. Now, sir, if you see Mongol very carefully, please mute your mic. If you see face is goal, orbits are goal, that is Mongol. If you see very carefully, in Mongol, we have bull tooth. In Mongol, we have bull-like tooth, as well as shovel shape incisor, as well as shovel shape incisor, bull tooth and shovel shape incisor, as well as enamel pearls. These are three important features of tooth of Mongol. Bull tooth, shovel shaped incisor, and enamel pearls are characteristic feature of Mongol. Now, sir, what about orbit? If orbit is square shape, it is Negro. And if orbit is triangular, it is Caucasians. If orbit is square shape, it is Negro. If orbit is square shape, it is Negro. If orbit is triangular, it is Caucasians. You can get this question. Orbit are square shape, it is Negro. Caucasians. Now, Dr. C for Caucasians, C for Carbelli cusp, C for Caucasian, C for Carbelli cusp are present in the teeth. Carbelli cusp are present in the teeth. So, Dr. You can get multiple questions regarding the cephalic index. Indians are mesetic. Yes. Negroes are dolichocephalic. Negroes are dolichocephalic. Very good. Mongols are brachycephalic. In Mongols, brachycephaly, coronal suture fusion. Coronal suture fuses early. This question also sometime asked in examination. What is brachycephaly? Coronal suture fuses early. That is brachycephaly. Brachycephaly. This is coronal suture fusion is early. This is brachycephaly. Okay, now sir, for race, what are other index used? We can remember by BCCI. These are other index for race. BCCI. The first we discuss cephalic index. B for brachial index. C for cephalic index, already discussed. Skull bone. C for crural index. I for intermembranal index. These are the index which are used for race. Brachial index, cephalic index. That's very simple trick. BCCI discriminate on the basis of race. BCCI discriminate on the basis of race. That is a very simple trick. So sometime you can get a question, what are the index which are used for race? These are brachial index, syphilic index, crural index, and intermembranal index. Now I'm putting some question. Write down. First question. Shovel-shaped teeth seen in which race? Shovel-shaped teeth seen in which race? Shovel-shaped teeth seen in which race? Okay. Square-shaped orbit, which race? Square-shaped orbit, Negro. Yes, absolutely right. Triangular-shaped orbit, which race? Yes. Caucasians. Very good. It is right. Caucasians. Carbelic cusp in the teeth are seen in which race? Carbelic cusp in the teeth are seen in which race? Caucasians. And Dr. Last, you can write down one thing about race. Hair are in hair. Medulla is non-fragmented in Mongol. In hair, medulla is non-fragmented in Mongol. All other has, yes, medulla fragmented. Medulla fragmented. This is all about race. You can get medulla is non-fragmented in Mongol. This is a very important MCQ. Now, sir, what about sex? Sir, for sex, we have some body. One is bar body. Bar body is present in female. Bar body present in female. Second is Davidson body, which is also present in female in neutrophils. And Oxab, D for Davidson body, D for drumstick appearance. D for Davidson body, D for drumstick appearance. When you see the Davidson body, it is just like a drumstick. You can get a question. Davidson body is just like a drumstick appearance. This is Davidson body. Davidson body is just like a drumstick. This is drumstick appearance. This is also seen in female. So this is the first bar body. This is second Davidson body. Third, for X chromosome, we use a reaction that is known as fusion reaction. For X chromosome, we use a reaction that is known as fusion reaction. For fusion reaction, we use acrylflavin stain. For fusion reaction, we use acrylflavin stain. Acrylflavin stain. Number 4, for Y chromosome, we use quinacrine reaction. For Y chromosome, we use quinacrine reaction. So you can see bar body is female, Davidson body is in female. For X chromosome, we use fusion reaction. And for Y chromosome, we use quinacrine reaction. Even, sir, by bones, we can decide sex. And for this, we have a table. For this, we have a table that is Krogman table. This is a very important MCQ. By bone, we can decide the sex. We have Krogman table. What is Krogman table? What is Krogman table? If you have pelvis bone, you can differentiate sex in 95% cases. If you have skull bone, almost 90% cases. So pelvis is the single best bone for sexual differentiation. But if you have complete skeleton, it means if you have complete skeleton, you can differentiate 100% cases. Doctor, so see option very carefully. If skeleton is given in option, you just pick skeleton. But if skeleton is not given in option, then you can pick pelvis. So see the option very carefully. Complete skeleton in 100% cases. Now, how to differentiate sexual bone in male and female? How to differentiate bone in male and female? This is known as Krogman table. Pelvis is the single best bone, and complete skeleton is the best thing to differentiate male and female. Because by this, अरे सोनो ए टाबरियन के बनी चुप रहे ए बारे खेले 24 घंटा खेले हाँ male and female. Okay, now male bones are large and heavy. Opposite is seen in female, small and light. You can write down opposite here. You can write down opposite here. In male, all bony prominences are in male. All bony prominences are more prominent. All bony prominences are more prominent. Okay, prominences are more prominent. But sir, in female, we have one bony prominences that is more prominent. This is frontal eminence. So what is the trick to remember? F for female, F for frontal eminence. F for female, F for frontal eminence. That is more prominent in female. More prominent in female. Sir, sternum length is more in male, less in female. Sternum length. सुनो, मैं एक चीज बोल रहा था. Sternum length is more in male, less in female. And Dr. Saab, this is a very important MCQ. This is a very important MCQ. This is known as Ashley rule. So sometimes you can get a question, sir. Ashley rule is related with which bone? The answer will be sternum. Sternum length is more, and here sternum length is less. Sternum length is more, and sternum length is less. This is the third. Now, if you see the pelvis, see the pelvis. Sir, male, there is no child in the pelvis. So pelvic shape of male is deep funnel shape. No child in the pelvis. So shape of the pelvis is this deep funnel shape in male. It is flat bowl shape in female. It is flat bowl shape in female. But sir, what about pelvic inlet? What about pelvic inlet? Sir, pelvic inlet in male is heart shape. Pelvic inlet in male is heart shape. In female, it is round or oval shape. This is pelvic. So what are the tricks to remember, sir? In female, frontal eminence is more prominent, FF. Ashley rule is related with sternum bone. Sternum length is more in male. Pelvic shape is deep funnel shape in male. Pelvic inlet is heart shape. Heart shape. Pelvic inlet shape is heart shape in male. और ऐसे भी याद कर सकते हो, कहते हैं ना कि मेल में दिल नहीं होता, तो दिल होगा कहां से? दिल तो मेल में नीचे होता है. दिल तो मेल में नीचे होता है, यहाँ होता है दिल. ओके, मेल आर हार्टलेस बिकॉज नीचे दिल नीचे होता है. इस ट्रिक से आप चाहो तो याद कर सकते हो. ओके, ये तो मैंने मेल प्रोमिनेंट थिंग बताई. नाउ आई विल डिस्कस व्हाट आर द थिंग्स व्हिच आर प्रोमिनेंट इन फीमेल. What are the things which are prominent in female? Now I will discuss. Pelvis bone has preauricular sulcus present in female, absent or very rare in male, that is prominent in female. And also pre-auricular sulcus is also known as tertiary sexual character. Pre-auricular sulcus is also known as tertiary sexual character. So this is the first thing which is prominent in female. Now, in female, most of the things are round. Female की ज्यादातर चीजें गोल होती है. Orbits are round, face is round, and most of the foramen are round. In male, most of the things are square shape. But sir, there is an exception. There is a exception. This exception is obturator foramen. Sir, obturator foramen in female is triangular and in male it is round. This is only exception. This is only exception, that is obturator foramen. Obturator foramen in female is triangular and it is round shape in male. Okay, this table is very important. All bony index value is more in female, less in male. Bony index value is more in female, less in male. Now this question comes, which is the best bony index? This is sciatic notch index. Which is the best bony index? Sciatic notch index. But sir, there is an exception. One bony index where value is more in male, that is corpobasal index. Sir, corpobasal index is index of sacral bone. Corpobasal index is an index of sacral bone where value is more in male. Next, chilotic line. Chilotic line. So chilotic line is more prominent in female in pelvis. It is less prominent in male in pelvis. Greater sciatic notch. Greater sciatic notch is wide and large in female. Opposite will be in male, and sir, it is the best parameter. It is the best parameter to differentiate male and female. And ischial spine. Ischial spine in female, ischial tuberosity or ischial spine, whatever it is everted and it is inverted. It is everted and it is inverted in male. Now I'm putting some MCQs right down. Okay. First, which is the best bone to decide male or female? Pelvis or complete skeleton? First question. Pelvis or complete skeleton? Okay. What is tertiary sexual character? What is tertiary sexual character? Tertiary sexual character. What's the name of tertiary sexual character? And present in which bone? Present in which bone? Tertiary sexual character. Pre-auricular sulcus present in female pelvis. Okay. Which is the best bony index to differentiate male and female? Best bony index. Best bony index to differentiate male and female. Sciatic notch index. Which is the best bony parameter to differentiate male and female? Best parameter. Greater sciatic notch. Dr. Saab, deep funnel shaped pelvis with heart shaped pelvic inlet is seen in. Deep funnel shaped pelvic, yes, it is male. Heart shaped pelvic inlet. Chilotic line in pelvic part is more prominent in. Chilotic line in pelvis part is more prominent in. Yes, it is female. Yes, it is female. Obturator foramen is triangular in male or female? Obturator foramen is triangular in male or female? What is the answer? Answer is female. Very good, sir. Very, very good. Very, very good. So this is how we decide sex. Now I'm coming to how we decide age. For age of fetus, we use rule of Hasse. For age of fetus, we use rule of Hasse. Doctor, for first 5 months and next 5 months, for first 5 months, age of fetus in month is equal to age of fetus in month is equal to length under root centimeter. For next 5 months, month is equal to length divided by 5 centimeter. Just I'm giving example. If month is 1 centimeter, 1 month, if month is 1, length will be 1 centimeter. If month is 2, length will be 4 centimeter. If month is 3, length will be 9 centimeter. If month is 4, length will be 16 centimeter. And if month is 5, length will be 25 centimeter. So whatever is given, if length is given, you can decide month. If month is given, you can decide length. This is for first 5 months. For next 5 months, we use this formula. This is if month is 6, length will be 30 centimeter. If month is 7, length will be 35 centimeter. If month is 8, length will be 40 centimeter. If month is 9, length will be 45 centimeter. At 10th month, almost 50 centimeter. This is for next 5 months. Sir, for next 5 months, this rule is also known as Morrison rule. For next 5 months, this rule is also known as Morrison rule. Anyway, sir, for first 5 months, again I'm revising, my dear friend. This is rule of Hasse. For first 5 months, month is equal to, this is month. Month is equal to under root of length centimeter. For next 5 months, month is equal to length divided by 5 centimeter. This is a very simple formula to decide length and month. Length and month. So sometimes length is given, you can detect month. If month is given, you can detect length. Next 5-month rule is also known as Morrison rule. Next 5-month rule is also known as Morrison rule. This is very simple. Now, sir, for deciding age in adult, we also use ossification center. We also use ossification center for age. For age. Now, sir, first we'll see appearance of ossification center. Then we'll see fusion. Appearance of the ossification center. Then we'll see fusion. Now, sir, appearance in fetal life. Appearance in fetal life. Fetal life. This is a very important MCQ. Which is first center appears in fetal life. This is center of clavicle. It appears in 5 to 6 weeks of fetal life. 5 to 6 weeks of fetal life. This is center of clavicle. So if you get a question, it is intrauterine life. Fetal life is intrauterine life. 5 to 6 weeks, this center appears. At 7 months, talus center appears. This is a very important MCQ. At 7 months, 7M is 7 months, talus center appears. Talus center appears. At 9 months of age, 9 months of age, lower end of femur lower end of femur and cuboid bone center appears. Dr. Sahab, again I am revising, my dear friend. This is I am talking about appearance. At this age, these center appears. Now, Dr. Sahab, you can get a question. Which is the first center appears? Center of clavicle. These all are center for. These all are center for intrauterine life. Fetus. Fetus life. Dr. Sahab, मेरे साथ रिवाइज करना. Okay. For fetus age, which rule is used? Rule of Hasse. Next 5-month rule of fetus rule is known as rule of Morrison. 8th month of age of fetus, what will be the length? 8th month of age of fetus, what will be the length? 8th month, 40 centimeter. 5 month of age, what will be the length? 25. 5 into 5, because it is square. This will be square. It's very simple formula. Which is the first center appears in fetus life? Center, ossification center appears in fetus life. Clavicle. At age of 7 month, which center appears? Age of 7 month, which center appears? Talus. Cuboid center appears at what age of the fetus life? Cuboid center. Okay, 9 month. So at 9 month, this cuboid center and lower end of femur appears. Now, sir, this is age of appearance. Now I am coming to bone fusion after birth. At what age, sir? Patella and gyphoid. Patella and gyphoid. Patella, लड़की को पटाने की उम्र स्टार्ट होती है 14 ईयर, दैट इज पटेला, 14 ईयर फ्यूजन. जिफोइड कब क्रॉस हो जाती है? एट 40 ईयर, 1440. पटेला एट 14 ईयर, लड़की पटेला, नहीं पटेला, क्रॉस एट 40 ईयर. जिफोइड. नाउ राइट डाउन IIT. IIT in year starts in 20 year, 21 year and 22 year. How to remember? I for iliac crest, fusion at 20 year, inner end of clavicle, 21 year, tuberosity, that is ischial tuberosity, that is ischial tuberosity. So it is 20 year, 21 year and ischial tuberosity as 22 year. 20, 21, 22. Iliac crest, inner end of clavicle and ischial tuberosity. These are the age. IIT. Very simple. Now in carpal bones, first carpal bone fuses, it is capitate, and last carpal bone fuses, it is pisiform, fusion at 12 years. First carpal bone fuses, it is capitate. Pisiform maximum age of fusion, it is 12 years. Carpal bones are done. Now what about upper limb and lower limb? Carpal bone first fusion is capitate. What about upper limb and lower limb? Upper limb you will start with high and lower limb you start with low. Sir, this is upper limb. Okay, this is upper limb. This is shoulder. This one start with high, 18 year, 16 year, 18 year. That is 18, 16, 18, 18, 16, 18. It means, sir, upper end of these are humerus. We have humerus bone. Yes. Then we have two bones. Yes. This is for upper limb. 18, 16, 18. 18, 16, 18. So if you get a question, sir, upper end of humerus, upper capitate is not in year, capitate is at 2 months of age. When child is 2 months of age, not in year. Okay, what about lower limb? Lower limb, same thing, but you will start with low. This is lower limb. So you'll start with low. You'll start with 16, 18, and 16. This is you have femur bone, yes. Then you have tibia and fibula. Tibia and fibula. So you can remember. So doctor, what is a trick to remember? A very simple trick to remember is a very. अरे छोड़ दे हेमेट हेमेट पढ़ाएंगे थोड़ा सा आपको उसमें हेमेट हेमेट सब पढ़ाएंगे आपको उसमें किसमें क्या नाम उसका ऑर्थोपेडिक्स में मेरे को फॉरेंसिक में इतना ही पढ़ाना है कि व्हाट इज द फ्यूजन ऑफ कैपिटेट एट 2 मंथ पीसीफॉर्म इज 12 ईयर ऐसे तो हेमेट क्यों है लुनेट का भी पूछा जाता है बट आप उसको ऑर्थोपेडिक्स में थोड़ा पढ़ना डिटेल में ऑर्थोपेडिक्स में पढ़ाते हैं इन चारों का अपर लिम्ब विल स्टार्ट विद 18 16 18 दिस इज 18 16 18 18 16 18 16 18 16 in lower limb upper end of femur at 16 lower end of femur and upper end of tibia fibula 18 and lower end of tibia fibula. So this is a very simple trick. For upper limb you'll start with 18 16 18, lower limb will start with 16 18 16. This is very simple trick to remember. Now sir, for skull bone it's very simple trick. For skull bone, which is the first suture M, last suture is also M, fusion. First suture is M for metopic suture and last suture is M for masto-occipital suture. Metopic suture fuses at 12 months, masto-occipital suture fuses at 80 year. 80 year. So first suture fusion is M and last is also M. Coronal and sagittal suture, both fusions start at 25 year and completes at 40 year. 25 year and 40 year. But sir, this is the best suture. Sagittal suture is the best suture for age estimation. Sagittal suture is the best suture for age estimation. Again, I am telling you friends, metopic suture is the first suture, M. Last suture is M for masto-occipital suture, 80 year of age. Best suture is sagittal suture. Now, Dr. Saab, which X-ray is taken for skull bone age estimation? Lateral skiagram. Which X-ray is taken for skull bone? That is lateral skiagram, head skiagram. Lateral head skiagram. So best suture for age estimation is sagittal suture. Best suture for age estimation is sagittal suture. We take lateral skiagram and first is M for metopic, last is also M for masto-occipital suture. Masto-occipital suture. Now what about sternum bone? So sternum has first part manubrium. This is manubrium. Then we have 4 pieces, 1, 2, 3, 4. Then we have gyphoid. So gyphoid fuses, I already told you at 40 year. Gyphoid fuses, I already told you at 40 year. Manubrium generally fuses at old age. At old age. Now what about these fusion? These fusion, yes, this. You just start with 15, 20, 25 year. 15, 20, 25 year. Anyway, sir, if you can remember, this is very important. This is sternum. This is sternum. डॉक्टर साहब, if you want to go in detail for carpal bones, वैसे आपकी इच्छा हो गई. She looks too pretty. Try to catch her. She looks too pretty. Try to catch her. These are 8 carpal bones we have. If you want to go in detail, you can remember by trick rule of 12, 5, 4, 3, 5 plus 4 plus 3 is equal to 12. Okay, these are in ear. And this is also 12. 5, 5, 1, 1. It is also 12, but it is outside. So just leave this. It is 5 year. It is 5 year almost. It is 1 year. It is 1 year. Hamate in the later part of 1 year. Capitate, as I told you, it is in 2 months. So both are in first year. 1 year, 1 year, but capitate in 2 months only. Okay. Anyways, if you want to go in detail at what age other carpal bones fuse, you just remember rule of 12. Rule of 12. This is rule of 12. Anyways, I'm going for some repetition program. See, write down. Write down. In age, in female, you can write down one more line. In female, fusion is 1 to 2 years earlier. In female, fusion is 1 to 2 years earlier. Doctor Saab, between third to fifth decade, best bone for age estimation is pubic symphysis. Best bone for age estimation is pubic symphysis. Between third to fifth decade. Third to fifth decade, best bone is pubic symphysis. Between 20 to 50 year, 20 to 25 year, sacrum bone become a single bone. All segment of sacrum fuses at the age between 20 to 25. 20 to 25. Okay. Anyways, sir, I am putting some question. Then you will realize how the question comes in exam. See, which is the first suture of the skull bone fused? Which is the first suture of the skull bone fuses? Write down. Metope. Which is the last suture of the skull bone fuses? Which is the last suture of the skull bone fuses? Masto-occipital. Which is the best suture of the skull bone? Best suture of the skull bone for age estimation, sagittal suture. Patella fuses at what age? याद करने का तरीका, लड़की को पटाने की उम्र कब स्टार्ट होती है? 14 year. Which is the last carpal bone fuses? Carpal bone, pisiform at fuses at what age? 12 year. 12 year. Yes. 12 year. Upper end of femur fuses at what age? Upper end of femur, you can see rule 18, 16, 18. For upper limb, we'll start with 18. Lower limb will start with 16. Inner end of clavicle fuses at what age? Inner end of clavicle. 21 year of age. IIT was the trick. IIT was the trick. Yes. Gyphoid fuses, sternum of the gyphoid of the sternum fuses at what age? Gyphoid X, 40 year. Between what age your all sacral segment becomes single bone? Between what age your whole sacral segment becomes single bone. Yes, that is the answer. Between 20 to 25 years of age. Which is the best bone to decide age between third decade to fifth decade? Pubic symphysis. Pubic symphysis. Very good, sir. Now, sir, in children for age estimation, for age estimation, we use dental formula, that is dentition. And so wherever I write down T, that will be temporary teeth. And wherever I write down P, that will be permanent teeth. Doctor, temporary teeth are 20 in number. 20 in number, temporary teeth. And friends, temporary teeth are 20 in number. Every quadrant has 5 teeth. 5, 5, 5, 5. But what is the formula for these 5? 2102. So here 2102, 2 will be in center, 2, 1, 0, 2, 2, 1, 0, 2, 2 will be in center. Okay, 2102, 2102. 2 are incisor, 1 is canine, premolar 0, molar 2, 2102, 2102. Same will be here. So total number we have 20. 2102, 2102, 2102, 2102. Now what is the sequence of eruption of these 2102? A very simple trick is IMCM, मैं chief minister, IMCM. First come incisor. At the age of 6 months in child, we have lower central incisor. Then comes molar, then comes canine, then comes second molar. Then comes second molar. 2102, 2102, 2102, 2102. Second molar, that is the last tooth, comes at the 2.5 year to 3 years. Sir, from 2.5 to 3 years, you will get all 20 temporary teeth. So, sir, if you get a question, sir, all 20 temporary teeth, first come incisor, then also come incisor, then come molar, then come canine, then comes molar. Between two molar, canine comes. So these 5 teeth comes. A very simple trick is to remember. IMCM. Now, this question comes, till what age? Till what age you will get all 20 temporary teeth? The answer will be 2.5 to 3 years. Now these 2.5 to 3 years till 6 years, you will have all 20 temporary teeth as it is. But what will happen, my dear friend, when you enter in 7 year? When you enter in 7 year, 6 to 7, sir, permanent teeth eruption starts. So now what will happen? Permanent will increase in number, temporary will decrease in number, total number will be 24 between 6 to 7 till 11 to 12 years of age. Permanent teeth increase in number, temporary will decrease in number, total number will remain 24. So between this age, this is known as mixed dentition. Why mixed? Because we have dentition. Why mix? Because we have permanent as well as temporary teeth. Now, sir, permanent teeth formula. Every quadrant has 8 permanent teeth. 8, 8, 8, 8. Now, what will be the formula of permanent teeth? It's very simple. It was 2102 in temporary. It is 2123, 2123, 2123, 2123, 2123, 2123. Now, what is this 2123? 2 incisor, 1 canine, 2 premolar, 3 molar. Incisor, canine, 2 premolar, 1 molar, 3 molar. 2 1 2 3. It's very simple. कुछ भी नहीं है, बहुत easy है. 2 1 0 2 2 1 0 2. Sequence is IMCM. 2 1 2 3 2 1 2 3. What is the sequence of this? Sequence of permanent teeth. It's very simple. Mummy is in pain. Mummy is in pain. Papa can make medicine. Mummy is in pain. Papa can make medicine. What is this? M I I P P P C M. Actually, you have to pick first alphabet. No, Dr. Saab, don't write it down. Just try to understand. घर जाके आराम से पढ़ना बहुत easy है. Don't try to write it down. It's very simple. Mummy is in pain. Papa can make medicine. Dr. Saab, first tooth erupts. First tooth erupt is molar. Yes, molar. Then incisor. Then incisor. Then premolar. Then premolar. Then canine. Then molar. Then molar. This is the sequence. So that is a trick we can do. Now we'll start with C. 6 year to 7 year. Just increase the age by 1. 7 to 8. 8 to 9. 9 to 10. 10 to 11. 11 to 12. 12 to 13. But last molar comes at 18 to 25 years of age. So this is for one quadrant. M, I, P, P, C, M, M. Same M, I, P, P, C, M, M. M, I, P, P, C, M, M. M, I. So it means, sir, it's not a single tooth. How many tooth do we have? How many teeth do we have? This is 4. 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 So total number of permanent teeth comes 32. At 11 to 12 year of age, at 11 to 12 year of age, you will have all permanent teeth 24, no temporary teeth. No temporary teeth, 11 to 12. Yes, you can see this one. You can see this one. Yes, 11 to 12. Now, 12 to 13, you will get 4 plus 24 plus 4. It is 28 plus 4. It is 30. That's very simple. Now, sir, see, between this age, now I'm putting one question to you. See, I'm putting some question. Don't write down, Dr. Saab. Don't write down. घर जाके बहुत easy है समझना इसको. Listen. See, if you get a question at 8 to 9 year of age, at 8 to 9 year of age, how many permanent and how many temporary teeth do you have? See, 8 to 9. Yes, make a cross here. 8 to 9. Done. How many permanent? 4, 4, 4. How many permanent? 4 plus 4 plus 4. That becomes 12. So total should be 24. If permanent are 12, temporary are 12, then it becomes 24. Very good. Very good. Very good. Very good, Damodar. Now tell me anyone. At 11 and at 10 to 11 year of age, this age. At 10 to 11 year of age, anyone. How many permanent and how many temporary teeth do we have at this age? See the permanent, anyone? See the permanent. How many permanent? Anyone? Anyone? How many permanent? Yes, Damodar, it's very simple. 20 permanent. 20 will be permanent. Temporary will be 4. That's very simple. Chalo. At 11 to 12, how many permanent? 11 to 12. 1, 2, 3, 4, 5, 6. 6 into 4. It is 24 permanent. Automatically, it is 0 temporary. It means, sir, when you enter in, yes, when you enter in 11 to 12 year, there is no temporary teeth. After that, only you have permanent teeth. 4 permanent added 28, that is 32. This is the sequence of permanent teeth. This is the, it's very simple. 2 1 2 3 2 1 2 3 2 1 2 3 2 1 2. What is the sequence? Mummy is in pain, Papa can make medicine. What is the sequence of temporary? IMCM, IMCM, IMCM. That's very simple. Okay, this is the simplest trick we have. Now, sir, आपसे कुछ क्वेश्चन पूछता हूं जब आपका जनरल नॉलेज चेक होगा. See, first question. At 4 years of age, how many teeth do we have? At 4 years of age, how many teeth do we have? 4 years of age. 4 years of age, how many teeth do we have? 4 साल में कितने दांत होते हैं हमारे? 20. Yes, 20. 20. All are temporary or permanent? All are temporary or permanent? Temporary. Mixed dentition is seen between what age? Mixed dentition is seen between what age? 6 to 7 to 6 to 7 to कहाँ यार 6 to 18? 6 to 7 to 11 to 12. 10 to 11 मान लो या 11 to 12 मान लो. It's okay. You can say till 12. Till 11 will be the best answer. Till 11 will be the best because 11 to 12 you only have permanent teeth. This is not a mixed. Very good. Very good. At 9 to 10 years of age, how many temporary and how many permanent teeth do you have? 9 to 10, how many permanent? 9 to 10. Let me see your answer. 9 to 10, how many permanent? 16 permanent and 8 temporary. Very good. 16 permanent and 8 temporary. Very good. And Dr. If at any age you want to decide that how many permanent teeth do we have, so there is a formula also. Number of permanent teeth is equal to age minus 5 into 4. This is the formula by which you can remember. Age minus 5, age in year minus 5. See, if you get a question at 9 years of age, 9 minus 5 into 4, that will be 16. 10 years of age, 10 minus 5 into 4, almost 20. 11 years of age, 11 minus, it means generally at 11 year of age, you get all 20 permanent teeth. This is very simple. If you want to go by formula, if you get, so here you will have 8 temporary teeth, here you will have 4 temporary teeth, here you will have 0 temporary teeth. If you want to go by formula. Okay, very good. Now, sir, as I told you, how many temporary teeth do you have? 2, 1, 0, 2 in one quadrant. 2, 1, 0, 2. 2 are incisor. 1 is canine. 0 premolar. 2 molar in one quadrant. In place of these temporary teeth, what do we get? Permanent teeth. Permanent teeth in one quadrant are 2, 1, 2, 3. Now, sir, if you see this quadrant, in place of these 5 teeth, these 5 teeth come. In place of these 5 teeth, these are incisor, canine, premolar, molar. In the place of these 5 teeth comes. These are known as successional teeth. In place of these 5 teeth come. These are known as successional teeth. First, but sir, for these 3 teeth, extra space is created. These are known as supra-added teeth. These are known as supra-added teeth. So, temporary के first 5 teeth की जगह, for these 5 teeth, these are 5, 2 plus 1 plus 0 plus 2, these are 5. These 5 teeth come in these places. These are successional teeth. But for these 3 extra teeth, extra space is created. These are supra-added teeth. So supra-added teeth are, I'm asking you a question. Supra-added teeth are incisor, canine, molar or premolar? Anyone? Supra-added teeth are incisor, canine, molar or premolar? Supra-added teeth are molar. So how many supra-added teeth do you have in your mouth? How many supra-added teeth do you have in your mouth? Anyone? Yes, Damodaran, 12. 3, 3, 3, 3. How many supra-added teeth do you have? 12. अरे जानू समझ में आ रहा नहीं आ रहा है? जानम निकलो. अरे समझ में आ रहा नहीं आ रहा जानू? हेलो, समझ में आ रहा नहीं आ रहा है? बोल ही नहीं रहे हो. ओके, वेरी गुड. बहुत सिंपल है, बहुत अच्छी तरीके से आपको प्यार से पढ़ा रहा हूं. ओके, okay, this is teeth. Now sir, how do we write down dental formula? First method to write down dental formula is Palmer notation. What is Palmer notation? See, Palmer notation, see, 4 quadrant we divide, 1 to 8, 1 to 8, 1 to 8 and 1 to 8. This method is known as Palmer notation. This method, this 1, 2, 3, if we write down present, absent, present, this is known as Palmer notation. This is Palmer notation. Okay, simple. Along with upper teeth, if we write down plus, along with upper teeth, if we write down plus 1, plus 2, plus 3, along with lower teeth, we write down minus. This method where we write down plus for upper teeth, minus for lower teeth, this is known as header-up formula. This is known as header-up formula. Palmer notation is 1 to 8, 1 to 8, 1 to 8, 1 to 8. Header-up formula. Now, third is universal formula. In universal formula, we are not dividing in 4 quadrant. Header-up formula, we also divide in 4 quadrant. Okay. So along with upper teeth, if we write down plus, and along with lower teeth, if we write down minus, that is a header-up formula. And 4 quadrant is Palmer notation. 4 quadrant is a Palmer notation. Okay, simple. Universal formula, we are not dividing in 4 quadrant, 1 to 16 and 17 to 32. If we write down in this manner, this is a universal formula. This is a universal formula. Universal formula. Are Karam Jalon, Prabhakaran, this formula, yaar Prabhakaran sach mein to pagal hai. This formula is used only for the age between 7 to 11 or 6 to 7 to 11. This is only used for mixed dentition formula. क्या पागल जैसी बातें करता प्रभाकरन तू यार, बावड़ा हो गया. This formula is only used for mixed dentition. What I should revise again? Sir, 4 quadrant, 1, 2, 3, 4. If we write down, it is a Palmer notation. If along with upper teeth plus is written, along with lower teeth minus is written, it is a header-up formula. If we are not dividing in 4 quadrant, we are writing 1, 2, 3, 4, 5, 6 till 16, 19, 20. This is universal formula. This is universal formula. 1 to 16, yes, 17 to 32. क्या रिवाइज क्या करना, मेरे को समझ में ये नहीं आया. बहुत इजी है ये तो यार, पूरा कंसेप्चुअल है. नंबर 4 FDI फॉर्मूला. Sir, what we do in FDI formula? See, this is 4 quadrant. Okay. Same. This is quadrant number 1. This is quadrant number 2. This is quadrant number 1. This is quadrant number 2. This is quadrant number 3. This is 4 quadrant here. Now, sir, here also you write down 8. Okay, but first digit will be quadrant number 2 1, 2 2, 2 3, 2 4, 2 5, 1 1, 1 1. Okay, then 1 2, then 1 3, then 4 1, 4 2, 4 3, 4 4, 3 1, 3 2, 3 3, 3 4. Actually, sir, first digit should be number of quadrant. Then same it is Palmer notation. First digit should be number of quadrant. First digit should be number of quadrant. 2 1. This is number of quadrant. Then it is number of teeth. देखो sir, simple. If we are writing down 1 to 8, 1 to 8, 1 to 8, 1 to 8, this is Palmer notation. 1 to 16, 17 to 32, if we write down in this way, it is universal formula. Along with upper teeth plus, along with lower teeth minus, it is Hedrup formula. This is first, second, third, fourth, 4 quadrant. We write down the first digit as the number of quadrant. This is 2 quadrant, 2 1, 2 2, 2 3, 2 4, 3 1, 3 2, 3 3, 3 4, 4 1, 4 2, 4 3, 4 4, 1 1, 1 2, 1 3, 1 4. अरे yes or no गोलगप्पों? अरे yes or no गोलगप्पों?
माहौल बन गया सर।
बनाना माहौल
बन गया सर, बन गया।
बहुत इजीली समझाया। ये प्रभाकरन तो बावड़ा हो गया आजकल। प्रभाकरन ने वो मिक्स्ड डेंटिशन के लिए वो एज यूज करनी है। ओके, अरे यस और नो? नाउ सर। ओके, प्रभाकरन को याद आ गया। चलो दोस्तों, अब डॉक्टर साहब, बाय टीथ एक्सरे वी कैन डिसाइड एज। एंड सर, for this we use a method, Gustafsson method. By teeth x-ray we decide the age. This is known as Gustafsson method. Gustafsson method is used for adult about 25 years of age, and there are 6 criteria. In 6 criteria, the best criteria is translucency of tooth. The best criteria of Gustafsson method is translucency of tooth. By teeth x-ray, we decide the age. This is known as Gustafsson method. We are using 6 criteria. Translucency of tooth is the best criteria. This method is known as Gustafsson method. This is first method. Stack method. Dr. Saab, stack method, we decide the age of infant by using teeth. And Dr. Saab, what we measure? Teeth weight and height. Teeth weight and height are measured. This is stack method. This is stack method. Boyd method, same. Boyd method, it is also used for infant age by incremental line. By incremental line, this is known as Boyd method. Boyd method. And fourth, Lemendine method. Lemendine method, we use gum regression. We use gum regression, that is known as Lemon-Dee. Again, I'm revising, my dear friend. By teeth, weight, and height, we examine the age. This is stack method. By incremental line of infant, we decide the age. That is a Boyd method. By gum regression, we decide the age. This is Lemon-Dee method. Lemon-Dee method. Lemon-Dee method. तो डॉक्टर साहब थोड़ा सा रेपिटेशन कर लेते हैं ताकि आपको थोड़ा अच्छा लगे, माहौल बना रहे. How many supra-added teeth we have? How many supra-added teeth we have?
12 sir.
12. 12. Total तो 12 होगा ना, 3 मत लिखो, total लिखो. Okay. Incremental line, we estimate the age. What is the name of method?
Boyd method.
Right? लिखो. Boyd method. Which is the best criteria for Gustafson method for age estimation? Best criteria for Gustafson method for age estimation? Translucency. Translucency of tooth. Very good. Very good. Gum regression is used in which method? Gum regression is used in which method? Yes, Lemon-Dee method. Lemon-Dee method. Translucency of tooth, gum regression, Lemon-Dee method. Sir, 4 quadrant having 1 to 8, 1 to 8. What is the name of method of dental formula? Palmer notation. Upper teeth plus lower teeth minus if written. What is the name of formula? Head-rub. Only 2 part, 1 to 16 and 17 to 32 teeth are given. What is the formula? What is the formula? Universal. Which is the first temporary tooth erupts? Which is the first temporary tooth erupts? I incisor, IMCM. I for incisor. IMCM. IMCM. Yes, sir. First temporary tooth is IMCM. Okay, sir. By next topic, by mummy is in pain, papa can make medicine. That is for permanent tooth. Mummy is MII. Okay, just remember. By bone length, we can decide stature. We can decide stature. Sir, see, you can remember fitur. Fitur. Fee for femur. T for tibia and fibula, both has. H for humerus. U for ulna. R for radius. Now, sir, what is a multiplication factor? Just remember 3.7. Just add 0.8. Fitur. 3.7 plus 0.8, 4.5. 4.5 plus 0.8, 5.3. 5.3 plus 0.8, 6.1. But in last, you add 0.4, 6.5. Okay. Now, sir, what is this? Sir, you found a bone femur somewhere. You found a bone femur somewhere. Length of femur bone, that femur bone is 30 centimeter. So what you need to do? 30 centimeter has to be multiplied by 3.7. Then you will get stature. Then you will get stature. That is 30 into 3.7. Yes, it is 111 centimeter. It means, sir, these are multiplication factor. These are multiplication factor. These are multiplication factor, and these were given by Carl and Pearson. These are multiplication factor, Carl and Pearson first. Carl and Pearson. Carl and Pearson, and Trotter and Glaser. Doctor, sometime a question comes, Carl and Pearson formula are used for stature. Now I am asking one question, write down. One numerical, write down. If you found a humerus bone, length 30 centimeter, what is the stature of a person? Humerus bone, length 30 centimeter, 30. Humerus 30 centimeter. What is the stature of a person? Anyone? Stature of a person, anyone? 13 to 5.3 karo na? Yes, Bhagwan, absolutely right. It is 159 centimeter. Yes, Bhagwan, absolutely right. This is 159 centimeter. So साहब आपको याद क्या करना? फितुर, फितुर 3.7 plus 0.8, 4.5 plus 0.8, 5.3 plus 0.8, 6.1 plus 0.4 last is that is 6. These were given by Carl and Pearson and Trotter and Glaser. Doctor, I will show you some picture. I will show you some picture. Yes. Okay. Sir, this is Hepburn osteometric board. This is Hepburn osteometric board. I don't know, Prabhakaran, why do you have a 28 teeth? There may be some teeth which are not erupted. Okay. And having some problem of calcium also. There are some three molar generally comes very late. Third molar, which is a wisdom tooth. So, Dr. Saab, by this we can decide length of bone. That is a Hepburn osteometric bone. This is Hepburn osteometric bone. Hepburn osteometric bone. We can decide the length of bone. So this suture in front part is a metopic suture. All other suture we know. And I told you metopic suture fuses at 12 months. You can get this question also. Metopic suture. We have discussed all these important parts.
सर स्क्रीन थोड़ा ज्यादा जूम हो गया.
ज्यादा जूम हो गया? हाँ?
हाँ सर.
सबके हो गया क्या ज्यादा जूम या सिर्फ तेरे ही हुआ है?
ना सर, हमारे ना हुआ.
तेरे ही हुआ है सिर्फ. This is Davidson body. This is Davidson body. As I told you, it's a drumstick body. It is present in female neutrophils. I told you this is present in female neutrophils. This is a Davidson body. So, anyways, ये कुछ images हैं जो हमें एग्जाम में आनी चाहिए और हमें मालूम होना चाहिए. We know all these images. Yes. Anyone? Upper teeth plus lower teeth minus. What is the name of formula? What is the name of formula? What is the name of formula? Hedrup formula. Hedrup formula. Very good. So these are some very important images you should know about your exam. Yes. Okay. Anyway, sir, this is all about identification. Now, sir, for multiplication factor were given by. चलो एक और 2-3-4 कुछ क्वेश्चन और पूछ लेते हैं. Multiplication factor were given by number 1. Which one? कौन से आदमी ने दिए multiplication factor? Number 1, Carl and Pearson. Second, Trotter and Glaser. Carl Pearson, Trotter, Glaser. Carl Pearson, Trotter, Glaser. इन्होंने multiplication factor दिए थे. What is a multiplication factor for femur? What is a multiplication factor for femur? Anyone? 3.7. Very good. What is a multiplication factor of humerus? 5.3. At the age of 10, how many permanent and how many temporary teeth do you have? At the age of 10, How many permanent and how many temporary teeth do you have? Age of 10. Yes, 20 permanent, 4 temporary. Very good. 20 permanent, 4 temporary. Very good. अच्छा समझ में आ गया तुम्हें इसका मतलब. Very good. Now, sir, I'm coming to a very important topic, my dear friend, medical jurisprudence. Medical jurisprudence. What is medical jurisprudence? It's opposite to the forensic medicine. It is of application of law during medicine, practice of medicine. It is application of law during practice of medicine. Means when you are practicing medicine, you should apply some law in India. It means, sir, you should be aware of some law in India. You should be aware of some law in India. This is medical jurisprudence. MCI Act. Sir, MCI Act, Medical Council of India Act passed in 1956. Now MCI has been converted in NMC, National Medical Commission. MCI Act passed in 1956. Sir, according to MCI Act, there are two schedules. Schedule 1, those doctors who have granted their MBBS degree in India are coming under Schedule 1. Those doctors who are foreign medical graduate are coming under Schedule 2. Schedule 2. Sir, but there is one more schedule, Schedule 3. In Schedule 3, we have first part and second part. First part and second part. But sir, first part are Indian graduate. First part are Indian graduate which are not coming under Schedule 1. Which are not coming under Schedule 1. And second part are foreign medical graduate which are not coming under Schedule 2. Means some foreign medical graduate which are not part of 2, some Indian graduate which are not part of 1, these come under third schedule. Third schedule. Third schedule. Now, sir, we have first body that is MCI and MCI. Second is State Medical Council. Again, I am telling you, in first schedule, Indian graduate. Second schedule, foreign medical graduate. Third schedule has two parts, first part and second part. In first part, those Indian graduate which are not coming in first part come under the first part of the Schedule 3. And those foreign medical graduate which are not the part of second schedule, that comes under second part of third schedule. Okay. SMC is State Medical Council. SMC is State Medical Council. SMC is State Medical Council. Dr. Sir, both MCI and State Medical Council, you are registered in both places, can be registered here as well as here. But sir, if doctor is involved in infamous conduct, if doctor is involved in some wrong conduct, that is known as infamous conduct. What is infamous conduct? What is infamous conduct? Serious professional misconduct. Serious professional misconduct is known as infamous conduct. It is known as infamous conduct. Serious professional misconduct. This is known as infamous conduct. Now, what are the infamous conduct where doctor is involved? You can remember 6A, I'll discuss B, C, D, F. What are the 6A during practice? A for alcoholism. If during practice doctor is involved in alcoholism, शराब पी रहा है. A for addiction, drug addict है. During practice doctor is involved in alcoholism, addiction, adultery, extramarital affair, abortion, criminal abortion, abortion. A is advertisement, wrong advertisement. And the last A is association. Association means giving or taking commission. So these all are infamous conduct. 6A, alcoholism, addiction, adultery, abortion, criminal abortion, advertisement, and association. What is association? Giving or taking commission. These are 6A. These are 6A, infamous conduct. B for bribe, if doctor is taking rishwat, bribe. C for covering. What is covering, my dear friend? Covering means doctor is covering non-medico. Doctor is taking help from non-medico. This is known as covering. He's covering non-medico. D for dichotomy. What is dichotomy? Fee splitting. Doctor take commission and split the fee of patient. Fee splitting of the patient. This is also a kind of commission association. Doctor, he's getting the fee from patient and he's giving commission to the other doctor. He's giving commission to the drug manufacturing company. He's giving commission to the diagnostic company, or he's taking commission. This is dichotomy. And the last is making false certificate. I have already told you, making false certificate is punishable under 197 IPC. Making false certificate is punishable under 197. Doctor sir, these all are infamous conduct or serious professional misconduct. Alcoholism, adultery, addiction, abortion, advertisement, association, bribe, नॉन मेडिको को आप कवर कर रहे हो. डाइकोटमी का मतलब पेशेंट को कमीशन बांट रहे हो या पेशेंट को दे रहे हो, या डायग्नोस्टिक कंपनी, यू आर स्प्लिटिंग द फी ऑफ पेशेंट and making false document is 197 IPC. You are taking and giving commission. Dr. Sahab, in these cases, State Medical Council, if it is not severe, will give you warning notice. State Medical Council either will give you warning notice, or sir, if it is very severe, State Medical Council can erase your name. This is known as penal eraser. What is penal eraser? Penal eraser is eraser of the name of a doctor from medical register. Eraser of the name of a doctor from medical register. From medical register, State Medical Council will erase the name. Means medical registration is cancelled. And Dr. Saab, this is also known as professional death sentence. Now, doctor won't be able to practice, maybe for few days, maybe for few weeks, few months, few years, or maybe lifelong. This is known as penal eraser. What is penal eraser? Now, Dr. Saab, if you get a question, penal eraser is a punishment given by. Penal eraser is a punishment given by which body? Anyone? Which body? I want to get the answer. Which body? It is SMC, State Medical Council. Yes, penal eraser is a punishment. Eraser of the name of a doctor from medical register. It is given. Now, sir, this is given by State Medical Council, confirmed by MCI, and you can appeal at Health Ministry. You can appeal at Health Ministry. This punishment is given by State Medical Council. Yes. Penal erasure is a punishment given by State Medical Council. First thing done. First thing done. It is punishment by State Medical Council. It is confirmed by MCI and appealed at Health Ministry. Appealed at Health Ministry. Health Ministry. This is known as penal erasure. This is known as penal erasure. Done. Nine. Nine. So penal erasure is a punishment given by State Medical Council. Yes, first question is done. Confirmed by MCI. Appeal is done at Health Ministry. This is penal erasure. Now, sir, there's a word comes professional secrecy. What is professional secrecy? A doctor should maintain the secret of patient. Secret of patient should not be disclosed to anyone. Secret of patient should not be disclosed to anyone. This is known as professional secrecy. Not to be disclosed to anyone. But sir, there are some exceptions. There are some exceptions. What are these exceptions? Known as privileged communication. What these action or exception are known as privileged communication. What is privileged communication? What is privileged communication? Sir, in some cases, doctor can reveal the secret of patient. Doctor can communicate. In some cases, doctor can communicate to someone. These are the example of privileged communication. Now, sir, question comes, what are the cases in which doctor can communicate? I'm putting some example. So my topic here is privileged communication. What are the cases where doctor can communicate? Doctor can communicate. Now, sir, I'm putting these number. See, civic sin. Civic first. What are the cases where doctor can communicate to someone? These are the example. Okay, yes, Bharat, I will let you know. Civic sin. What are the example of privileged communication? Now see. See for criminal case. If any criminal case comes to a doctor, like murder, suicide, doctor informs this to police or magistrate. And sir, this is 39 CRPC. 39 CRPC. Infectious disease. Sir, any infectious disease to a patient, doctor informs this to the relative. Doctor informs this to the relative. Venereal disease. Venereal disease is sexually transmitted disease. Sir, any sexually transmitted disease is to be informed to the partner. Court of law. Sir, court of law. If magistrate or judge ask any question, doctor has to inform. Yes, doctor has to inform. Servant, and if servant has a disease, which is life endangering for other, has to be informed to the employer. Example, a very simple example. You are a train driver. You are a train driver and you are colorblind, my dear friend. So this has to be informed to the train department. You are a train driver and you are colorblind. It has to be informed to the railway department. This is servant disease if that is dangerous. Now, sir, what are 2I? If there is any interest of patient, it has to be informed to the patient or relative. Or if there is any interest of a doctor, it has to be informed to some people. Interest of patient and interest of doctor. Now, sir, last two. And for notifiable disease. Sir, there are certain disease in India which has to be notified to the health department. Which has to be notified to the health department, like HIV, like cholera, like plague. So these diseases should be notified to the health department. And for negligence cases, my dear friend, any negligence case should be informed to the patient or relative. Any damage to the patient because of negligence should be informed to the patient or relative. I am summarizing all these things again. Sir, what I am discussing, these are the example of cases which are known as privileged communication. Doctor has to communicate to the some authority. Like first, criminal case informed to the police or magistrate. Infectious disease informed to the relative. STD informed to the partner. Interest of patient informed to the patient or relative. Court of law inform the court. Servant and employer relationship inform the employer. Interest of a doctor informed to some person. And Dr. Saab here informed to the health department. And here if negligence take place, informed to the patient and relatives or relative. This is privileged communication. डॉक्टर साहब हिंदी में क्या बोलते हैं? प्रिविलेज का मतलब भला, कम्युनिकेशन का मतलब बताने से. अगर बताने से किसी का भला होता है, चाहे वो हमारा देश हो, चाहे किसी की जान हो, चाहे हमारा समाज हो, चाहे पेशेंट का भला हो, चाहे गवर्नमेंट का भला हो, चाहे कानून का भला हो, चाहे जज का भला हो, चाहे वाइफ या हस्बैंड का भला हो, चाहे रिश्तेदारों का भला हो, तो सर वो मैंने वो भले ही बताए आपको. किन किन चीजों में किन किन चीजों का बताने से भला होता है. दिस इज नोन एज प्रिविलेज कम्युनिकेशन. बताने से भला. कम्युनिकेशन का मतलब बताना, प्रिविलेज का मतलब भलाई. अरे यस और नो गोलगप्पों. तो चलो 3-4 सवाल के जवाब लिखो. Penal eraser is a punishment given by which body? Penal eraser is a punishment given by which body? Anyone? SMC. Penal eraser is confirmed by which body? MCI. Appealed at which level? Appealed at which level? Appealed at which level? Health Ministry. Very good. Health Ministry. Doctor should inform the criminal case to the police or magistrate with CRPC. Should inform to the police or magistrate with CRPC. Let me see your answer. 39 CRPC. Foreign medical graduates which are not included in second schedule comes under which schedule? Schedule 3 second part. Complete Schedule 3 second part. Schedule 3 second part. That will be the better answer. Okay. Okay, sir. Now I am coming to sir negligence. And sir, here we are going to discuss medical negligence, which is done by medical staff. I have already told you 304A IPC is applicable. It is also known as malpraxis. It is also known as malpraxis. So two type of negligence we have: civil, criminal. Civil negligence, criminal negligence. What is civil negligence? Sir, civil negligence is known as tort. Civil negligence is known as tort. Tort. What is civil negligence? Absence of skill, absence of care. There was no skill, no care. Absence of skill and care. Sir, Dr. Saab, here there is mild damage to the patient. Here patient has mild damage. So doctor has to pay money only. Doctor has to pay money only. Burden of proof, onus of proof. Sir, patient has to prove this. Patient has to prove this. Patient need to prove this. Patient need to prove this. Lack of skill, lack of care, mild damage, doctor gives money, burden of proof to the patient. Example, overdose, leading side effect, wrong prescription card. Overdose, leading side effect, and wrong prescription card, sir, leading some damage. These are the example of civil negligence. Civil negligence. But sir, what is criminal? What is criminal? Gross negligence. Gross negligence. Gross negligence, willful negligence, or lack of competency. You are not competent and you are doing. Sir, here may be death or severe damage. Death or severe damage, sir, not only compensation, but also 304A IPC. So it will be dealt in criminal code. It will be dealt in civil code. Sir, here it will be civil code. It will be dealt in criminal code. Criminal code. Criminal code. Sir, burden of proof. Here, burden of proof is to the doctor. Doctor needs to prove there was no negligence from my side. Gross negligence, willful negligence, lack of competency, death or severe damage, it is money plus 304A IPC. Doctor needs to prove. Example, a surgeon forgot instrument in the body. Surgeon forgot instrument in the body, that is leading death. Leading death. Or you have right leg gangrene, but doctor removed left leg. You have right leg gangrene, but doctor removed left leg. Sir, these are two examples which are for criminal negligence, because there are chances of death, chances of severe damage. Severe damage. Surgeon forgot instrument in the body. Right leg gangrene, doctor removed left leg. These are the example of criminal negligence. Now, sir, see these two example and these two example. These two are example of civil negligence, and these two are example of criminal negligence. But sir, if you see, these are sufficient to prove negligence, and these are also sufficient to prove negligence. These are sufficient to prove negligence, and these two are also sufficient to prove negligence. Anything which is sufficient to prove negligence, anything which is sufficient to prove negligence, sir, this is known as res ipsa loquitur. Anything which is sufficient to prove negligence is an example of res ipsa loquitur. Res ipsa loquitur. Res ipsa loquitur. What is res ipsa loquitur? Thing or fact which speaks for itself. Thing or fact which speaks for itself is an example of res ipsa loquitur. Now, this is sufficient to prove negligence. This is sufficient to prove negligence. Example. What is the example? Surgeon forgot the instrument in the body, that is sufficient to prove negligence. Right leg gangrene, doctor removed left leg, that is sufficient to prove negligence. Anything which is sufficient to prove negligence is res ipsa loquitur. It means, sir, res ipsa loquitur proves civil negligence as well as criminal negligence. Now I'm going to take break. Just will ask you some question. Tort is example of civil negligence or criminal negligence. Tort is example of civil negligence or criminal negligence. TORT, tort. Civil negligence. Burden of proof in civil negligence present on civil negligence. किसको prove करना होता है? Patient. Burden of proof in criminal negligence is on doctor. Res ipsa loquitur proves civil negligence, criminal negligence, both. Both. Civil, criminal, both. So, कहाँ पहुंचे हम दोस्तों? Res ipsa loquitur. Things or fact which speaks for itself. Now, sir, there is a word which is known as novus actus interveniens. What is the meaning of this? Novus actus interveniens. Novus means new. Novus means new. Actus is action. Interveniens means intervening. New action intervening. Novus actus interveniens means new action intervening. And Dr. this new action is unrelated and unexpected. Unrelated or unexpected. This action intervene. This is known as novus actus interveniens. Novus actus interveniens. If unrelated or unexpected action intervene the case, please mute your mic. Intervene the case. This is known as novus actus interveniens. Unrelated or unexpected action intervening the case. So If a doctor is involved in any unrelated or unexpected case action, doctor will be responsible. If doctor is involved in any unrelated or unexpected action, that doctor will be responsible. Like doctor giving some drug leading death, doctor giving some electrolyte leading some heart failure. So if doctor is responsible or involved in unrelated or unexpected action, intervening the case, doctor will be responsible. This is novus actus interveniens. Novus actus interveniens. Okay, done. Now, sir, what are the defense available for a doctor? Defense for a doctor in medical negligence cases. Defense for a doctor in negligence cases means, first, doctor should take informed consent. Doctor should take informed consent. What is the meaning of informed? Everything should be informed to the patient. This is known as informed consent. Everything is informed to the patient is known as informed consent. If doctor is getting informed consent, it is a defense. Second, time limitation. Sir, if patient wants to file a case against a doctor, time limitation is 2 years. It means if today you have damage, you can file a case within 2 years of damage. This is known as res indicata. This is an indicator of time, res indicata. Res indicata. Number 3, res judicata. Third defense for a doctor, res judicata. But just remember, res judicata is defense in civil cases only. What are the defense available for a doctor? First, doctor should get informed consent. Time limitation for patient to file a case is 2 years. And res judicata is a defense in civil cases only. Civil cases only. What is res judicata? You just remember the name. When you will prepare for PG exam, I will let you know. Res judicata is for civil cases only. Now, fourth defense is contributory negligence. Sir, what is contributory negligence? Negligence contributed by doctor and patient. Negligence contributed by doctor and patient. Sometimes doctor is more responsible, sometimes patient is more responsible. It is also a defense in civil case. It is also a defense in civil case. Contributory negligence. Number 5th, therapeutic misadventure. Therapeutic misadventure. So what is therapeutic misadventure? Some unintentional act leading complication. Some unintentional act leading complication. This is known as therapeutic misadventure. Now, sir, this unintentional act may be therapeutic first, may be therapeutic, may be diagnostic, and may be other. But sir, here main thing is it is unintentional act leading complication. Now, sir, this is a defense in civil as well as criminal negligence. This is a defense in civil as well as criminal negligence. Civil as well as criminal negligence. And Dr. Saab, this is also known as medical Mal-occurrence. Medical mal-occurrence. What is medical mal-occurrence? You are taking proper due care. You are taking proper due care, but still you get damage. You are taking all proper due care, but still you get damage. This is medical mal-occurrence. Okay, like sometimes you are going for all proper care, but still you got some injury during the surgery, during the medical procedure. This is known as medical mal-occurrence. Again, I am revising, my dear friend. What are the defense available for a doctor? First, doctor should get, मेरे साथ रिवाइज करो. First, doctor should get which consent? Which consent from the patient? Which consent? Which consent from the patient? Informed. हर चीज inform करनी. What is the time limitation for patient to? What is the time limitation for patient to file a case? 2 years. Res judicata. Res judicata is defense in which case? Res judicata is defense in which case? Yes. Civil negligence only. Contributory negligence is a negligence contributed by doctor as well as patient. Contributory negligence is a defense in civil cases or criminal cases. Civil cases or criminal cases. Yes, it is civil cases. Therapeutic misadventure is used to see criminal negligence, civil negligence, or both. Criminal, civil, or both. Yes, it is both. It is any unintentional act leading some damage. This is known as therapeutic misadventure. This is known as therapeutic misadventure. Very good. Now, sir, another important word comes here. Next word. This is, so medical, डॉक्टर साहब अगर आपको बाई चांस पूछ ले कोई सवाल, this question came in AIMS exam recently. A doctor was performing a operation and with due care, but the patient got ureter injury. The doctor will get defense under which law? What will be the answer, my dear friend? What will be the answer, my dear friend? Doctor will get defense under which law? Which important word? Yes. This is ड्यू केयर के बाद भी अगर कॉम्प्लिकेशन हो जाता है तो डॉक्टर विल बी डिफेंड मेडिकल माल अकरेंस. वेरी गुड. इट इज मेडिकल माल अकरेंस और थेरापेटिक मिसएडवेंचर. मेडिकल माल अकरेंस इज द बेटर वर्ड फॉर दिस. इफ यू आर टेकिंग ड्यू केयर, still you get damage, that is medical malpractice. Okay, okay. Now, sir, there are some tests for medical negligence. There are some tests for medical negligence. You just remember the name of these two tests. One is Bolam test, another is Bolitho test. One is Bolam test, another is Bolitho test. Just remember the name. Just remember the name. So these all are defenses. Yes, these all are defenses available for a doctor during medical negligence cases. Now, sir, the next word comes vicarious liability. Vicarious liability. Vicarious liability is also known as respondent superior. It is also known as respondent superior. And another word is let master answer. Another word is let master answer. Doctor Saab, what is this? Doctor Saab, what is this? Like you are an employer. And sir, some employee is working under you. Employee is working under your power, under your scope. And if this employee does some negligence act, sir, first, because employee is not working independently, this negligence is transferred to the employee. Means first answer has to be given by employer. First answer has to be given by employer. Means if you are working under any Fortis hospital, first Fortis hospital will give the answer. That's why I told you, let master answer. Let master answer. After this, this will be transferred to the employee. After this, but sir, for this you have to work under the power of any employer. You have to work under the power of any employer. This is known as vicarious liability. Your first negligence is transferred to the employer. Let master answer. Let master answer. This is a very important liability, relationship between employer and employee. Relationship between employer and employee. Okay. Now next is another very important word, euthanasia. Euthanasia. Euthanasia is causing painless death. Euthanasia is causing painless death, and it is also known as mercy killing. It is also known as mercy killing, causing painless death. Now, Dr. Saab, two types of euthanasia we have, active and passive. Active and passive. What is active? You give some drug and causing painless death. Example of drugs given are phenobarbital, thiopentone sodium, phenobarbital, thiopentone sodium, opium, or potassium. These can cause active euthanasia. These can cause active euthanasia. Now, passive, you remove life-sustaining procedure. You remove life-sustaining procedure like ventilator, like ICU. This is known as passive euthanasia. In India, only passive euthanasia is legalized. In India, only passive euthanasia is legalized. Passive euthanasia is legalized. But Dr. Saab, this question comes, in India, only passive euthanasia was legalized. First country where active plus passive, first country where active plus passive both got legalized, it was Netherlands. It was Netherlands. In India, this passive euthanasia got legalized only in 2015. Only in 2015. So first country to legalize passive euthanasia is Netherlands, as well as active euthanasia. Passive and active. But sir, in India, it is not voluntarily. You have to take the permission of Supreme Court. You have to get the permission from Supreme Court, then you can go for passive euthanasia. Passive euthanasia. First country where active plus passive both got legalized, this was Netherlands. This was Netherlands. Anyways, sir, giving drug causing death is active euthanasia, and removing resuscitation is a passive euthanasia. Active and passive. Active and passive. Yes, friends. Now, sir, I'm coming to very important word, consent. Consent is a relation between doctor and patient. Doctor takes consent, patient gives consent. It is a relation between doctor and patient. Sir, consent is a part of Indian Contract Act. Consent is a part of Indian Contract Act. It's a contract between doctor and patient. Doctor takes consent, patient gives consent. It is a part of Indian Contract Act. Indian Contract Act. Now, sir, what are the types of consent? Consent is a relation between doctor and patient. Doctor लेता है, patient देता है. हाँ साहब, कर लूं, कर लूं. The first consent is expressed consent. Express consent. It is of two types: verbal or written. If you say verbally something, this is expressed. Or if you're writing, yes, sir, I'm ready, this is also a express consent. Express consent. Second is implied consent, my dear friend. What is implied consent? Sir, it is not verbal, not written. It is not verbal, not written, but still you are ready. Still you are ready for procedure. You are ready for procedure. Example, a patient a patient comes to OPD and he is ready for blood pressure without saying anything. Patient comes to the OPD, doctor takes his BP instrument, patient is ready, gives his hand, yes, without saying anything. This is implied. No need to say anything. You are ready for any BP blood pressure. You are ready for physical examination. This is implied consent. I am giving a very simple example. A female patient going to male gynecologist chamber, a female patient going to male gynecologist chamber, that means female patient is ready. Female patient is ready to get examined by male doctor. This is implied consent. एक तो क्या होता है बोलना, yes sir I am ready, I am writing, yes sir I am ready. This is expressed. Without saying anything, without writing anything, if you are ready for something which is an implied consent, which is a implied consent. So number two consent is implied. Number two consent is implied. Number three, informed consent, my dear friend. Informed consent. Dr. Saab, if doctor disclose everything to the patient, doctor disclose everything to the patient in patient language, this is a informed consent. Doctor disclose everything to the patient in patient language, language of the patient. That is a informed consent. That is a informed consent. So most of the time, doctor goes for informed consent. This is the best consent, my dear friend. This is the best consent, my dear friend. Okay. Number four, blanket consent. Blanket consent is also known as open consent or blind consent. Open consent or blind consent. What is this? Sir, see. Patient, at the time of admission of patient in hospital, admission of patient in hospital, sir, only admission of patient in a hospital, that covers everything. That covers everything. Doctor Saab, patient has given hospital admission consent only. But sir, now treatment, diagnosis, follow-up, Doctor Saab, everything is covered in the single consent. Everything is covered. Once you give consent for admission in the hospital, that covers everything forwarding, that is a blanket consent. That is a blanket consent. And Dr. Saab, this is not valid legally. This is not valid legally. You should get consent for everything, but it is a consent. You are giving consent just for admission in hospital, but you are covering everything after that. This is a blanket consent. Number 5, substituted consent. Substituted consent. If someone is not available, if someone is like a patient is unconscious and person is incapable, I'm giving example, you are incapable of giving consent, then who will give your consent? Any family member or next to kin, your father, your mother, spouse. If you are not capable of giving consent, then other person gives consent, that is your family member. This is known as substituted consent. In loco parentis, sir, sometimes parents are not available. You are a minor child, you are less than 18 years of age, and you are going for surgery. Sir, your parents is not available. If your parents is not available, police, warden, guardian, these can give consent. Police, warden, guardian, these can give consent. That is known as in loco parentis. Now, sir, a very important MCQ comes. A child below 12 years of age, a child below 12 years of age cannot give consent for physical examination. A person below 18 years of age cannot give consent for any surgery or invasive procedure. Any surgery or invasive procedure or invasive procedure. Below 12, you cannot give consent for physical examination. Yes. Below 18, you cannot give consent for surgery. Doctor, this is a very important law, 87 IPC. This is very important law, 87 IPC. What is 92 IPC? Sir, doctor can start the treatment. Doctor can start the treatment without consent. That is protection of a doctor who can start the treatment without consent. But sir, this should be life threatening. Life threatening, like road traffic accident. Road traffic accident, doctor can start the treatment. In life threatening conditions, it is applicable for life threatening condition. It is applicable for life threatening conditions. Sir, this is 92 IPC. This is 92 IPC. 92 IPC. 92 IPC. Very, very important. Now, sir, the last two words for this topic. Medical etiquettes. Medical etiquettes. It's a courtesy between medical professionals. Sir, all you are doctors in India should help each other. Even if you become a very big doctor, you should having helping hand for every other medical fraternity. That is etiquettes. ऐसा नहीं है कि आप बड़े डॉक्टर बन जाओ तो आप छोटों को भूल जाओ. This is known as medical etiquettes. This is known as medical etiquettes. Medical ethics. Moral principle of a doctor. moral principle of a doctor for society, for community, for country, for patient. Sir, this is known as medical ethics. And Dr. Saab, this law is self-imposed. This law is self-imposed. This law is self-imposed. This is known as medical ethics. It means, sir, morally you are strong or not. Morally you are doing ethical things or not. That is known as medical ethics. Morally you are doing. Now, sir, I'm giving you two options. You have to pick one answer. Okay. Now, sir, which is illegal, which is unethical? Okay, I'm writing two things: unethical, illegal. Now, my question for you. Wrong advertisement is, means you are a MBBS doctor and you are writing MD or DM degree in front of you. Wrong advertisement is illegal or unethical? Anyone? Illegal or unethical? It is illegal. Repetition of advertisement. Every day you are repeating your advertisement. Ki mera saman le lo, mera saman le lo. It is illegal or unethical? Yes, it is unethical. Repetitive advertisement is unethical and wrong advertisement is illegal. Illegal, you get punishment, but for unethical things you can get warning. You can get warning. So this is the basic difference between unethical and illegal. Unethical and illegal. This is the basic difference. चलो सर, इसको अब थोड़ा सा डिटेल में पढ़ते हैं. मैं आपको एक एक एमसीक्यू देता हूं. राइट डाउन. फर्स्ट क्वेश्चन. ओके. Penal erasure is a punishment given by State Medical Council. State Medical Council. Foreign medical graduates which are not coming in second schedule are part of third schedule second part. A doctor should inform everything to the police or magistrate which is medico-legal is coming under which CRPC? 39 CRPC. A doctor is obliged to communicate everything to the concerned authority. What is this known as? Doctor is obliged to communicate everything to concerned authority. What this word is known as? Doctor should communicate everything to the concerned authority. What this word is known as? Communicate. What is the word? अरे क्या बोलते हैं उसको? इतना बड़ा तो लिखाया था ऊपर. Privileged communication. Yes, the answer is privileged communication. Yes, this is privileged communication. Okay. In criminal negligence, onus of proof goes to. Onus of proof. Onus is burden of proof. Okay. Onus of proof goes to doctor in criminal negligence, which is sufficient to prove negligence, medical negligence. What is the word which is sufficient to prove? That's a legal word, Latin word, which is sufficient to prove negligence. Res ipsa loquitur. Res ipsa loquitur. What is res indicata? How many years you get to defend yourself? Means patient can file a case within 2 years. Res judicata is defense in. Res judicata is defense in civil case, criminal case, both. Civil. Therapeutic misadventure is defense in civil case, criminal case, both. Both. Contributory negligence is a defense in civil case, criminal case, both. Civil case only. Employer is responsible for employee negligence under which law it is known as dash 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 liability, vicarious liability. In India, which euthanasia is legalized? Passive euthanasia. Consent come under which law? Indian Penal Code, CRPC, Indian Evidence Act, Indian Contract Act. IPC, CRPC, IEA, Indian Contract Act. Yes, answer is Indian Contract Act. If patient is ready for physical examination without telling anything, what this consent is? Implied consent. Single consent covering many procedure is a part of which consent? Single consent covering many consent is a part of which consent? Blanket consent. Dr. Saab, a road traffic accident took place and the patient was taken to the hospital. Doctor started the treatment without taking consent. This is a protection for a doctor under which IPC? 92 IPC. Medical professionals should be cooperative to each other. What this is known as? Medical etiquettes. Moral principle of a doctor. Moral principle of a doctor. It is medical ethics. Unrelated, unexpected action of a doctor intervening the case is known as unrelated, unexpected, yes, action of a doctor intervening the case is known as novus actus interveniens. Yes, my dear friend, novus actus interveniens. Very, very good. Now I am coming to very important topic, my dear friend, that is thanatology. Thanatology. Dr. Thanatology is study of death. Thanatology is study of death. Thanos is a god of death. Thanos is a god of death. Death is defined under 46 IPC. I already told you. And Dr. Death is a death when brainstem dies. Death is a death when brainstem dies. This is thanatology, study of death. So whenever brainstem dies, we use this word death. For brainstem death, we use Minnesota criteria. For brainstem death, we use Minnesota criteria. Minnesota criteria. Sir, postmortem changes after death. This is known as taphonomy. Postmortem changes after death. This branch is known as taphonomy. Taphonomy. Two types of death we have. Two types of death we have. One is somatic death. Another is cellular death. Postmortem changes study is known as taphonomy. One is somatic death. What is the meaning of somatic death? Sir, it's very simple. A person is clinically died. Person is clinically died. It means, sir, if you are clinically died, that is a somatic death. But if your cells die, that is a cellular death. Cellular death is also known as molecular death. And there is a time interval which is known as supravital interval. There we have time interval which is known as supravital interval. We have a time interval which is known as supravital interval. Supravital interval. Supravital interval. Now, Dr. Saab, what is clinical died person? We have a tripod which is known as Bishop tripod. What is Bishop tripod? If your lung, heart, and brain stops, if your lung, heart, and brain stops, this tripod is known as Bishop tripod. This tripod is known as Bishop tripod. Then you are somatically died. Then you are somatically died. Lung, heart, and brain stops. Lung, heart, and brain stops. This is Bishop tripod. Then you are somatically died. Between somatic and cellular death, you have a time interval. This is known as supravital interval. This is known as supravital interval. Supravital interval. Now, Dr. Sometime you are in suspended animation. You are in suspended animation. Sir, what is the meaning of suspended animation? What is the meaning of suspended animation? Sir, actually you are alive, but you look die. You are alive, but you look die. This condition is known as suspended animation because of some decreased metabolic activity. You are alive. What are the example? A, B, C, D, E. A for after anesthesia, prolonged anesthesia. After prolonged anesthesia, you sometimes look like a dead person. B for newborn babies. Sometimes newborn babies look like this. C for cholera and concussion. Yesterday I told you concussion is temporary unconsciousness. Concussion is temporary unconsciousness. By head injury, you look like a dead person. D for drowning. E for electrocution after electric shock. After electric shock, electrocution. G, H. H for hypothermia and hyperthermia. Hypothermia and hyperthermia. These are two examples, hypothermia and hyperthermia. And the last is few S. S for shock, S for sunstroke, S for shock, S for sunstroke, and S for insanity. Shock, sunstroke, and insanity. Yes, shock, sunstroke, and insanity. And the last is very, very important. Sometimes T for trance. T for trance. You are doing yoga and other activity. Yoga and other activity. This is trance. So these are the findings you can see in which you look like dead person. Please mute your mic. Again, I am revising. What are the points? After prolonged anesthesia, कई बार anesthesia बहुत ज्यादा लग जाता है. Newborn बच्चा पैदा होता है. Cholera and concussion, head injury in cholera. Drowning, yes. Electrocution, electric shock. Hypothermia and hyperthermia में भी ऐसा होता है. Shock, sunstroke and insanity. And the last is trance. Doing yoga, you hold your respiration. Doctor Sahab, there is no respiration, no circulation, but still you are alive. So, in all these cases, doctors should resuscitate the patient. Resuscitation is required. In all these cases, resuscitation is required. Sir, this is known as, yes, this is known as suspended animation. Animation means sign of life, suspended means stopped. Animation means sign of life, suspended means stopped. But good news is you are alive. This condition is known as suspended animation. Suspended animation. याद कैसे करोगे? A for anesthesia, B for beyond, C for cholera, D for drowning, E for electrocution, S for shock, sunstroke and insanity, and T for trance. These are the condition you are in suspended animation. You are in suspended animation. Okay, this is very, very important. Now next, sir, what are the postmortem changes? And I have already told you, anyone, the study of postmortem changes is known as, anyone, the study of postmortem changes is known as, yes, I want to get the answer, taphonomy. Yes, my dear friend, taphonomy. Study of death is known as, study of death is known as thanatology. Thanatology. And Dr. Saab, remember, death was first defined in Sydney. Death was first defined in Declaration of Sydney. Sydney. Declaration of Sydney. Now, sir, we are coming to postmortem changes. First question comes, earliest change of the death. Earliest change of the death is insensibility and loss of voluntary power. Insensibility and loss of voluntary power. This is the earliest change of death. This question comes in exam. Change of the death. What is the meaning of earliest change? There will be the insensibility. There will be loss of sensation and loss of voluntary power. This is earliest change of the death. Earliest change of the death. Now, sir, after death, length of a person is increased. Length of a person is increased after death because relaxation of intervertebral disc. Relaxation of IVD, intervertebral disc. That is, length is increased. So it means length is increased up to 2 to 3 centimeter. The logic is simple. Because of relaxation of intervertebral disc, length is increased. Now, first is insensibility and loss of voluntary power. Second is length is increased. Third, we have eye changes. What are the changes in eye? Just remember K, K. What is first K? Kevorkian sign and potassium increases in vitreous humor. First is Kevorkian sign. This is a first eye change. What is Kevorkian sign? See, this question comes in exam. Kevorkian sign. Retinal vessels fragmentation. Retinal vessel fragmentation. Sir, this sign is known as Kevorkian sign. Retinal vessels fragmentation. Doctor, this is the earliest change of the eye. This is seen within few minutes of the death. Within few minutes of the death. So there will be retinal vessel fragmentation like this. So this is known as railroading phenomena. This look like a railroad. This is known as railroading phenomena within few minutes. So this is the first change. You will see Kevorkian sign, retinal vessels are fragmented. Second is potassium ion increases in vitreous humor. Third change is Takenoir. Third change, Mesicu ecchymotic line is found in which death? सनु कल पढ़ाया था ना जानू? कल पढ़ाया था ना? Perthes syndrome. Perthes syndrome is traumatic asphyxia. पढ़ाया था ना? It's a line of demarcation between compressed and non-compressed area. This is known as Mesicu ecchymotic line. सर ये क्वेश्चंस पूछ रहा था, कौन पूछ रहा था? अच्छा ऐसे ही, ओके ओके कोई बात. The third finding in eye is Takenoir. Actually, sir, Takenoir are black spot in the eye, in sclera part. Black spot in eye in sclera part, and it is seen 3 to 6 hours after death. It is seen 3 to 6 hours after death. I will show you the picture also. This is your pupil. Okay, and in this side you have a triangular black color. This is black color. I'm making it red color, but it is black color. On both sides there may be triangular deposition of cell. Deposition of cell debris. This is known as Takenoir. Takenoir. So you can get a question, sir. Takenoir are black deposition in sclera part seen after death in 3 to 6 hours. Seen in 3 to 6 hours. 3 to 6 hours. Last change, intraocular pressure. Intraocular pressure becomes 0 after 2 hours of death. Intraocular pressure, intraocular tension becomes 0 after 2 hours. 0 tension after 2 hours. Intraocular pressure. So anyways, I am revising this. Kevorkian sign is railroading phenomena. First question. Then potassium increases in vitreous humor. Takenoir are seen as a black color changer of the sclera part, seen in 3 to 6 hours. And the last but not the least, intraocular pressure becomes 0 after 2 hours. So these are the changes. Now I am coming to, sir, after death, temperature decreases. And sir, this phenomena is known as algor mortis. After death, temperature decreases. This phenomena is known as algor mortis. Algor mortis. Now, if you see the graph, this is the graph between temperature and time since death. If you see the graph between temperature and time since death, you will see the graph is just like this. This is sigmoid curve. Sigmoid curve. So this phenomena is known as algor mortis. So temperature is decreased after death. This phenomena is known as algor mortis. Now, where would you detect temperature? Sir, ideal site for detecting temperature is rectum. Because rectal temperature is equal to core body temperature. Because rectal temperature is equal to core body temperature. Rectal temperature is equal to core body temperature. Now, sir, what is rate of fall? What is rate of fall? Doctor Saab, rate of fall is different in summer and different in winter. Rate of fall is different in summer and different in winter. In summer, it is 0.5 degree Fahrenheit per hour. In winter, it will be high, double, 1.5 degree Fahrenheit per hour. Why in winter it's high? Because in winter outside temperature is less, the rate of fall will be more. So in winter, rate of fall is 1.5 degree Fahrenheit per hour. Rectum is the best site. Now, what is normal? You can say, what is normal body temperature, your core body temperature? Almost 98.5 degree Fahrenheit. Okay. Now, but what about centigrade? What about centigrade? Sir, for centigrade, rate of fall is 0.5 to 0.6 degrees centigrade per hour. For centigrade, rate of fall is 0.4 to 0.6 degrees centigrade per hour. Rectum is the ideal site to record the temperature. Core body temperature is equal to the rectum. Core body temperature is 98.5. Now, sir, I'm putting one question. See, what is the question? You got a dead body. Okay. You got a dead body. And rectal temperature of dead body, rectal temperature of the dead body is 91 degree Fahrenheit in summer. Now, anyone who can tell me what is the time of death? See, what is rectal temperature of the dead body? 91 degree Fahrenheit. Listen, what is normal temperature of the dead body? 98.5. So 98.5 minus 91, it means how much fall is seen? 7.5. For 7.5 degree Fahrenheit per hour fall, yes, Bhagwan, absolutely right. For 7.5 degree Fahrenheit fall in summer, you will require 10 hours. Yes, it's very simple. For 7.5 hour Fahrenheit fall in winter, you will require 5 hours. That is a very simple. Yes, sir. That is a very simple trick to remember. Yes, भगवान शायद शर्मा जी, आप बहुत सही बोल रहे हो भैया कि आपका टेम्परेचर जितना भी हो उसको नॉर्मल टेम्परेचर से कम कर दो. वॉट एवर फॉल इज देयर, दिस फॉल इन समर, दिस फॉल इन विंटर, this how we calculate time since death. Time since death. Time since death. And Dr. Saab, for temperature of the dead body, we use thermometer. Thermometer is used for temperature of the dead body. Thermometer. Thermometer is used for temperature of the dead body. Definitely the best site is rectum. We can use some other site also, but the best site is rectum. Rectum is the ideal place. Rectum is the ideal place for this. Rectum is the ideal place for recording temperature. Recording temperature. Okay. This is known as, yes, this is known as algar mortis. Now I am coming to next death change. Next death change is color change of the skin. Next death change is color change of the skin. And Dr. Saab, this is known as postmortem lividity. postmortem staining, postmortem lividity, postmortem staining, hypostasis, vibices, sugillation, and sir, liver mortis, all are seen. Postmortem staining, postmortem lividity, postmortem staining, postmortem lividity, hypostasis, vibices, sugillation, and liver mortis, all are seen. There is color change. It is a very early sign of death. Now, sir, it is seen in dependent part of the body. It is seen in dependent part of the body. It is bluish purple color. It is bluish purple color. It is bluish purple color. Dr. Saab, all those part of the body, see, this is a body in supine position. This body in supine position. This dead body is in supine position. Now, what are the dependent part of the body which are not touching the ground but facing towards ground? The part which are not touching the ground and facing towards ground, in these part there is gravitational force. So what will happen in this part? There is venocapillary distension. There will be capillovenous distension. In this part, because of gravitational force, there will be capillovenous distension, and blood will accumulate. And observe, this blood has deoxyhemoglobin after death. And this deoxyhemoglobin provides bluish purple color to dermis layer. And sir, this dermis layer is known as rete mucosum. This dermis layer is known as rete mucosum. So there will be, after death, you have deoxyhemoglobin. Observe, you will see these area which are not touched with the ground, there will be bluish purple discoloration. This is known as postmortem staining. Postmortem staining. And observe, so in supine position, it will be seen in posterior part. This is posterior part. In prone position, postmortem staining will be seen in anterior part. In moving body, postmortem staining is absent because postmortem staining is only developed when body is stable. In hanging body, it is common in glove and stocking pattern. What is glove and stocking pattern? See, so see if this body is hanging. Yes, this body is hanging. Now, sir, these are the parts which are not touching the ground and facing towards ground. These are leg and hand. So this is known as glove and stocking pattern. In hand and leg, these are not touching the ground and facing towards ground. Blood accumulates in this area. This is known as glove and stocking pattern. And maximum it is seen in feet. Maximum postmortem staining seen on feet. But sir, now the question comes. So first thing is clear. It gives idea about position of the body. It gives idea about position of the body at the time of death. Position of the body. Again, I'm telling you, those parts, postmortem staining, postmortem lividity, liver motis, VBC, suggestion, are seen in those parts which are not touching the ground and facing towards ground. In pressed area, जो area ground को touch करते हैं उस पे नहीं होती. This is postmortem staining. Now see, it is visible. It is visible just after death. You can say shortly after death. Well developed, well visible in 4 hours after death, and maximum visible in 6 to 12 hours after death. Shortly after death, well visible, maximum visible in 6 to 12 hours after death. Now, sir, after 7 to 8 hours, it is fixed to the position. After 7 to 8 hours, it is fixed to the position. Fixed to the position. It means if your body remain in a certain position for 6 to 7 hours, 7 to 8 hours, it will be fixed to that position. Fixed to that position. This is fixation time. Now, till what time it persists? Sir, this color of the skin persists till decomposition. This color of the skin persists till decomposition, because after decomposition, your body become green color. So till your body become green, this postmortem staining persists. Because in decomposition, your body become green. In decomposition, your body become green. Now I will show you the picture, because this picture comes in exam. Okay. This one is the first picture, my dear friend. This is liver motis, postmortem stain. You can see these are the part which are not touching the ground. There will be bluish purple discoloration because of capillovenous distension in dermis retimucosum layer seen shortly after death. This is known as liver motis or postmortem staining, hypostasis, VBCs, suggestion. Okay. Now, sir, this is a death change. This one is a death change. I told you this is seen in eye of the sclera. This is cell debris of sclera part seen in 3 to 6 hours. This is known as technoia. This is known as technoia. 3 to 6 hours after death, your changes, these are known as technoia. Technoia. Hello? जय जिंदर सर. अब वायरल, कोरोना भी वायरल है और वो ही वायरल है. अच्छा. दोनों वायरल है. मैं हमारा पैरासीटामोल डोलो 650. अच्छा. और डोलो 650, ताकत की गोली एजिथ्रोमाइसिन. ठीक है. एंटीबायोटिक दे दी. अब देखो. अच्छा. मैं विटामिन सी भेजी इसको. और एक पापा रामदेव कोरोलिन भेजी. और एक और खांसी वाली सिंगला भेजी. तो दवाई देख लीजिए आप, जो दे दीजिए. देख ली मैं. देख ली. हर 4-5 घंटा होनी बुखार नोट करना है। हाँ, और 99.5 या 100 ऊपर जावे नहीं तो हाथों हाथ दवाई देनी है। 99.5 ऊपर ही मान लो, 99-99.5 ऊपर। कहीं ध्यान मैंने देखियो तो कोनी ऑक्सीमीटर जरूरत कोनी, हाल तो बैक नॉर्मल है तो कोई दिक्कत कोनी। नॉर्मल वायरल भी हो सके सही तो सब भाई, या तो नॉर्मल वायरल हुआ है या कोरोना हुआ, दो ही तरह का हुआ है। अगर तैयार हो जाए तो नॉर्मल वायरल है, नहीं तो पछा अपन वो अपन ट्रीटमेंट पूरा लंबू लेना पड़ेगा। यहाँ पे सेम ही ट्रीटमेंट है, सब ही ट्रीटमेंट है। ट्रीटमेंट है हाँ, ठीक है तैयार हो जाए। जय बच्चे आप सोचो। यहाँ तो बढ़िया रही हो, नहीं बढ़िया काम। और यूं ही वायरल ही है। मैं तो 5-7 दिन ले लुआ नक्की कर दी। कोरोनिल तो खत्म होगी मांगे। 7 दिन लिपी। हाँ, अब ले लियो 7-8 दिन, ज्यादा दवाएं गर्मी करो। हाँ हाँ, और कहीं अब जिक्की चीजें लेने, अब बॉडी की इम्यूनिटी पुरानी काम आई। नहीं नहीं बढ़िया है, ठीक है सर। So this is glove and stocking pattern is seen in this, visible shortly after death, well developed in 4 hours, maximum 6 to 12 hours, fixed in 7 to 8 hours. Now sir, persist till decomposition. When your body become green, till this time this postmortem staining persists. Now sir, see, in different poisoning cases or different cause of death, postmortem staining is different, color is different. Like see, carbon monoxide poisoning. In carbon monoxide poisoning, it forms carboxyhemoglobin. That's why color is cherry red. That's why the color is cherry red in carbon monoxide poisoning. Carbon monoxide poisoning. In cyanide poisoning, cyanide forms cyanohemoglobin. Bright red color. Bright red or brick red, cyanide poisoning. Bright red or brick red. Hydrogen sulfide poisoning, H2S, sulfahemoglobin. Hydrogen sulfide, sulfahemoglobin, bluish green color. Opium poisoning, black color of postmortem stain. Black color. Opium poisoning, black color. Hypothermia. Hypothermia, it is giving pink color, bright pink. So sir, at least you revise this: carbon monoxide cherry red, cyanide bright red, hydrogen sulfide bluish green, opium black color, hypothermia death, it is bright pink color, phosphorus, nitrates and chlorates, dark brown or chocolate brown color. Dark brown or chocolate brown color. Dark brown or chocolate brown color. These are colors seen in phosphorus, poisoning, nitrate and chlorate. Phosphorus, nitrate, chlorate. And even you can write down aniline. Aniline also has the same color. So, carbon monoxide gives cherry red color. Carbon monoxide gives cherry red color. Cyanide gives bright red or bright red color. Hydrogen sulfide gives bluish green color. Opium gives black color. Hypothermia, this is a very important MCQ. If person died due to hypothermia, bright pink color. Aniline, phosphorus, nitrate and chlorate, dark brown color. चलो कुछ MCQ पूछता हूं, फिर आगे बढ़ते हैं. चलो. Decrease in temperature is known as, dead body decrease in temperature is known as liver mortis or algar mortis? Liver mortis or algar mortis? Algar mortis. What is rate of fall of temperature in summer in Fahrenheit? In Fahrenheit. Rate of fall. 0.75 degree Fahrenheit per hour. What is the ideal site to record temperature? Ideal site to record temperature. Rectal. Rectal. Vibices, sugillation, hypostasis are other name of. Vibices, sugillation, hypostasis are other name of. Postmortem staining. Postmortem staining or liver mortis, both are same. Or postmortem lividity. Postmortem lividity is maximum developed after how many hours of death? 6 to 12 hours. Persist till what changes of death? Persist till what changes of the death? Decomposition. Hypothermia, what is the color of postmortem staining? Hypothermic death? Bright pink. Hydrogen sulfide poisoning? Hydrogen sulfide, bluish green. Opium poisoning? Black. Aniline and phosphorus poisoning? Dark brown. Glove and stocking postmortem staining is seen in death due to hanging. Vishnuevsky spot in stomach mucosa is a postmortem finding of. Vishnuevsky spot in stomach mucosa is a postmortem finding of hypothermia. Hypothermia. Simon hemorrhage of intervertebral disc of lumbar vertebra. Lumbar disc is seen in Simon hemorrhage. Simon hemorrhage. Lumbar vertebra hemorrhage. Lumbar intervertebral disc hemorrhage. Hanging. Yes, Sanu, hanging. INICET sign of carotid artery tear is characteristic of. INICET sign of carotid artery tear is characteristic of. Judicial hanging. डॉक्टर साहब आप तो कमाल हो भैया, कमाल हो, आप सब हीरे हो भाई साहब, आपकी कद्र तो जोरी कर सकता है भाई, आप सब के सब कमाल हो, मैं तो आपके सामने कुछ नहीं, मैं एक नाचीज हूं. मसल स्टिफनिंग. बस बस सर बस. क्यों रे हरीश, क्या हुआ? हरीश क्या हुआ? कमाल नहीं हो गया? आपके चेले हैं, चेले हो लेकिन यार सब आता है तुम्हें, बहुत टैलेंटेड बच्चे हो तुम. muscle stiffening. Now after that we have some muscle stiffening. After that we have some muscle stiffening. What are the name of muscle stiffening? First, heat stiffening. Second, cold stiffening. Third, gas stiffening. Fourth, rigor mortis. Fifth, cadaveric spasm. Fifth, cadaveric spasm. Now, if body is surrounded by heat, we have heat stiffening. But sir, heat stiffening is seen when temperature surrounding the body is more than 65 degrees centigrade. And Dr. Saab, here mechanism is coagulation of muscle protein. Here mechanism is coagulation of muscle protein. Yes. Heat stiffening mechanism is coagulation of muscle protein. Cold stiffening, it is when body is surrounded by cold, it is because of frozen body fluid. Gas stiffening, sir, in decomposition, in your body gas forms. In decomposition, in your body gas forms. This causes gas stiffening. This causes gas stiffening. Gas stiffening. So another important word we use, gas stiffening. In decomposition of gas forms in your body, this causes gas stiffening. Rigor mortis mechanism is ATP depletion, and cadaveric spasm mechanism is ATP depletion. Sir, rigor mortis is rigidity of muscle. It is also known as cadaveric rigidity. Cadaveric rigidity. Cadaveric rigidity. Rigor mortis is because of ATP depletion. It is also known as cadaveric rigidity. RM, cadaveric rigidity. Now, Dr. Saab, we'll start rigor mortis. This is a very important muscle stiffening. Rigor mortis, RM. Cadaveric rigidity. Rigidity of muscle in cadaver. Dr. Saab, RM is rigor mortis, the cadaveric rigidity, rigidity of muscles. Like this is a death point. After some time of the death, there is stiffening of muscle. Stiffening of muscle starts. This is known as rigor mortis. Stiffening of muscle as well as shortening of muscle, but mainly it is stiffening. Shortening is less. It is also known as Sommer's movement. Mechanism I already told you, ATP is depleted. Due to this, you can remember rigor mortis has stiffening of muscle, shortening of muscle, Sommer's movement. All are same. Mechanism is. Doctor, this is a time interval between death and rigor mortis. This is known as primary flaccidity or primary relaxation time. Primary flaccidity means first muscle is in this stage, then muscle is in this stage. First muscle is in primary flaccidity or relaxation phase. Yes, this is the first phase. Second is this, rigor mortis. Now, sir, what will happen? See, now decomposition starts. In decomposition, your muscle actin and myosin filament. In decomposition, your muscles actin and myosin filament are broken. So again muscle goes in secondary relaxation phase. This is the third stage. So Dr. Saheb, this is first stage, this is second stage, and due to decomposition, muscle goes in. This is first stage, yes. This is second stage, this is third stage. Muscle goes in relaxation again, actin and myosin filament is broken. This is known as secondary relaxation phase. This is known as secondary relaxation phase. Dr. Sahab, rigor mortis involve voluntary muscles as well as involuntary muscles. It involves all body muscles, voluntary muscles and involuntary muscle. Now this question comes, which is the first muscle to be involved? First muscle involved is myocardium. First muscle involved is myocardium. But first it is myocardium in half an hour to 1 hour after death. It is seen. First external muscle is upper eyelid. And in upper eyelid, it develops in 2 to 3 hours. Overall, first muscle is myocardium, develops in half an hour to 1 hour. Yes. In myocardium, it develops in half an hour to 1 hour. And first external muscle is upper eyelid. It develops in 2 to 3 hours after that. Now see, this is upper eyelid. After developing upper eyelid, it involves facial muscles, then neck muscles, then facial muscles, then neck muscles, it first appears in myocardium, then in eyelids, then neck, then it goes downwards to upper limb, so Dr. Saab, one thing is clear, it starts from here, then it goes downwards, upwards to downwards. This is known as Nishtain law. So the last muscle in which it will be developed, that is muscle of toes. The last muscle in which it will be developed, that will be muscle of toes. So starting from upwards and going downwards, this is known as Nishtain law. Nishtain law. For rigor mortis, we use rule of 12. For rigor mortis, we use rule of 12. What is rule of 12? What is rule of 12? In first 12 hours, it develops in all muscles of the body. In next 12 hours, it remains as it is in all muscles of the body. And in next of the body. First 12 hours develops in all muscles of the body. Next 12 hours, it remains as it is in all muscles of the body. And next 12 hours, so 12 plus 12 plus 12, 36 hours. It means it appears in the body and disappears in the body, takes 36 to 48 hours. We can give the range, But generally 12 plus 12 plus 12, 36. We can give the range 36 to 48 hours. 36 to 48 hours. First 12 hours, it develops all over the body. Next 12 hours, it remains as it is all over the body. And sir, next 12 hours, it disappears from all over the body. This is rule of 12 for rigor mortis. This is rule of 12 for rigor mortis. Rigor mortis. Now, sir, fetus below 7 months of age. Fetus below 7 months of age. Not seen. Very feeble. Fetus below 7 months of age generally not seen. In violent death means your muscles is already in action, like drowning, firearm injury. In violent death, onset and duration is different. In violent death, it comes early and duration is short. Violent death, where muscle is already in action. Fetus below 7 months of is not seen. Violent death, or in children, or in wasting disease, where your muscle mass is very thin, it comes early and duration is short. In strychnine poisoning, this is another important word. It comes early and duration is long. In strychnine poisoning, it comes early and duration is long. And in arsenic poisoning, it comes late and duration is long. Again, I'm revising, my dear friend. In violent death, it comes early and duration is short. In strychnine poisoning, comes early and duration is long. Arsenic poisoning, it comes late and duration is long. You can remember by a trick if you want to remember. Arsenic, you can remember ALL, arsenic late long. Strychnine, you can remember STEAL, early late long. So you can remember these: early onset, short duration; early onset, long duration; late onset, long duration. These are some very, very important feature of rigor mortis, cadaveric rigidity. Cadaveric rigidity. Now, sir. So rigor mortis is seen in all death. मेरे साथ रिवाइज करना. What is the mechanism of rigor mortis, anyone? What is the mechanism of rigor mortis? What is the mechanism of rigor mortis? ATP decrease. In rigor mortis, which is more, stiffening or shortening of muscle? Which is more? Stiffening is more than shortening. Rigor mortis is also known as dash 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 rigidity. Which rigidity? Rigor mortis. Cadaveric rigidity. Rigor mortis is also known as dash movement. Dash movement. Somer's movement. Rigor mortis starts from upwards and goes to the downwards. What's the name of law? What is the name of law? Name of law. Nishtain law. Which is the first muscle in which rigor mortis is seen? Myocardium. Which is the first external muscles? Upper eyelid. fetus below 7 months of age, rigor mortis is not seen. Arsenic poisoning, early, long, late, long, what is seen? Arsenic poisoning, late, long, late onset. And Dr. Saab, one thing is clear, rigor mortis gives idea about time since death. Rigor mortis gives idea about time since death. Dr. Saab, this is rigor mortis. But yesterday I discussed one thing in drowning, that is cadaveric spasm. Yesterday I discussed one thing in drowning, that is cadaveric spasm. What is cadaveric spasm? In drowning I discussed clench hand with some grass particle, and this suggests antemortem drowning. Now, sir, how it is this stiffening is differentiated from rigor mortis? How this stiffening is differentiated from rigor mortis? First, sir, mechanism is same as rigor mortis, ATP depletion. Second, rigor mortis takes some time to develop. It is just after death. Any muscle which is in action after death, it remains in same action. This is cadaveric spasm. Just after death. So here, primary relaxation phase is absent. Here, primary relaxation phase is absent. It is just after death. It is known as instantaneous rigor. It is also known as cataleptic rigidity. ATP depletion just after death. Just after death, it is primary relaxation phase is absent. It is instantaneous rigor or cataleptic rigidity, also known as. Sir, it is seen in few death. Rigor mortis is seen in all death. It only involves voluntary muscles. It only involves voluntary muscle. Other muscles, rigor mortis involve all muscles. Mostly it involves hand muscles, short group of muscles, hand. Sir, it gives idea of mode of death. Antemortem, postmortem, no time since death, mode of death. And sir, it is a very hard stiffening. It gives idea about mode of death. It is a very hard stiffening. So generally it is not broken. Not broken. Not broken. Generally it is not broken. Again, I'm revising, sir. In few cases, muscle goes in contraction and after death, it remains in contraction. This is known as cadaveric spasm. It is not cadaveric rigidity. It is seen in few muscles only, in few death only, just after death. So primary relaxation. और दरवाजा बंद कौन करेगा? जबरदस्त. Primary relaxation phase is absent. Instantaneous rigor. Cataleptic rigidity. Mechanism is same as ATP depletion. It is seen just after death. Primary relaxation phase is absent. It is known as instantaneous rigor. Cataleptic rigidity, it is seen only in few death, not in all death. Few death. It generally involves voluntary muscle. Mode of death, it is not broken. Now, sir, what are the death in which it is seen? It is not seen in all death. I start with A. Asphyxial death, it can be seen. Brain injury, A, B. Brain injury, it can be seen. Cerebral injury, it can be seen. Drowning, I told you, it can be seen. Drowning. Exhaustion, it can be seen. Firearm and fear, it can be seen. Arey, Dr. Sahab, rigor mortis is seen in every case. After death, your body will remain for a longer period. There will be rigor mortis. Rigor mortis is a universal phenomenon. Cadaveric spasm is seen in only in few death. Cadaveric spasm is seen in few death, like sometime in asphyxial death, sometime in brain injury, cerebral injury, drowning, exhaustion, firearm, or fear. Doctor, I'm giving example. If I'm committing suicide, after suicide, my hand remain in this position. This is cadaveric spasm. But rigor mortis will be seen in all body parts, all body muscles after death. This is rigor mortis. Rigor mortis takes some time to develop. Cadaveric spasm in few muscle, it is seen just after death. And cadaveric spasm is a very tough stiffening. Generally, it is not broken. Generally, it is not broken. It gives idea about mode of death. Rigor mortis give idea about time since death. Rigor mortis gives idea about time since death. Time since death. Now I am coming to, sir, the last death change. Okay, honey. Okay, Janu. Decomposition. चलो जाने वाले जाओ, थोड़ा रिवाइज कर लेते हैं आज का. ये तो कर लेते हैं. What are other name of cadaveric spasm? Anyone? What are other name of cadaveric spasm? Two names. It is seen just after death. These two names are instantaneous rigor and cataleptic rigidity. Instantaneous rigor and cataleptic rigidity. Now, what is the mechanism of cadaveric spasm? Anyone? What is the mechanism of cadaveric spasm? Yes, anyone? Yes, friends. It is mechanism of cadaveric spasm. It is ATP depletion. Cadaveric spasm gives idea about time since death or cause of death or mode of death. What is the best answer? What will be the best answer? Mode of death. Mode of death. Cadaveric spasm involves voluntary muscle, involuntary muscle, all muscle, short group of voluntary muscle. Which will be the best answer? Voluntary muscle, involuntary muscle, all muscles, short group of voluntary muscles. Yes, short group of voluntary muscle will be the best answer. Cadaveric spasm in cadaveric spasm in drowning suggest it's antemortem drowning, postmortem drowning, both, none. Okay. Yes, sir. This is suggestive of antemortem drowning. Most characteristic finding of antemortem drowning. Very good. Most characteristic finding of antemortem drowning. No issue. Ma'am, temporary or permanent teeth, it's a big topic. It's not a very small topic. But I can give you idea. Temporary teeth eruptions, these are 2102 is a formula. 2 is incisor, 1 is canine, 0 for no premolar. and 2 is molar. The eruption sequence is IMCM. IMCM is incisor, molar, canine, and molar for temporary teeth. Permanent teeth formula is 2123 that has been mentioned in notes. The sequence of eruption is mummy is in pain and papa can make medicine. M for mummy ka matlab we have to pick the first alphabet. Mummy is molar, then is for incisor. That is the way we can remember. Mixed dentition is seen between 6 to 7 to 11 to 12 year. Here total number of permanent teeth are always 24. Okay. Okay. चलो दोस्तों हम कल मिलते हैं फिर